All right. Where shall we begin? What is the goal? What are you guys thinking? I have some questions, but I've never been a guest on a live before. Okay. Hi, Susie. How's it going? I mean, you can type them in chat, or I can request you if you want, and you can join. TJ, we're live every night, dude. We're live every night, talking about science, politics, and the world in between, covering the coolest things in science that nobody else is talking about except for here, right here. Oh, what's up, Hard Pills? How's it going, man? What's up, Skog? How's it going? All right. Oh, cool. There you go. Hi, Christy. How's it going? Oh, you might be muted. It seems there's some muffled. There's some. I can almost hear you. Hey, Samison, how's it going? Yeah, I did hear something. Hi, SK Anna, how's it going? I heard something before, Christy. It's all good. Don't worry about it. Hi, Luna. Try try muting yourself, or maybe you're connected to Bluetooth on something. You gotta on it. Oh no, Samison, no. How you feeling, man? Not good, I guess, since you're in the urgent care. Hoping for the best, dude. Oh, there we go. Christy, I hear you. Barely. You're really far away. I think that you're connected. Your Bluetooth is connected to something that's far away.
I have no idea what it would
There we go.
be.
There we go.
You can hear me?
Yeah, there we go. I can hear you now.
Okay. You can hear me. You
Yeah.
can hear me well?
Yeah, I can. How's it going? Hey, Duke Ray.
Sorry.
Don't be.
This
No.
is Hi, how are you?
Good. I'm so happy that this is your first live experience. This is cool.
Yeah, I'm kind of nervous, so
It's just me and you. We're chilling. It's all good.
right, not gonna read the chat.
Yeah, don't.
So I am going to my primary care this week, and I've gotten every COVID-19 booster that I've been able to get.
Nice.
I'm in my early 40s.
Okay.
And so last time I was in my primary care doctor's office about 3 months ago, I had spoken with him about the possibility of it being a little more difficult this season to get a booster.
Yeah.
And what that might look like with my medical history.
Mm-hmm.
And I had thought that he was someone that was for the COVID vaccine.
Oh no.
He had always seemed that way to me. He is part of like a bigger organization that like feeds into a hospital too.
Okay.
It's an organization that has hospitals in the area, and then also has a bunch of facilities that have doctors and things like that.
Okay.
So I started talking to him, and then shortly realized that he was not on the same page anymore about COVID vaccines as he had previously been. He started mentioning, kind of vaccine injuries and how maybe it wouldn't be such a great idea. Yeah, and I was shocked.
It's awful.
Yeah, I was like, wow.
Just to let you know, those vaccine
Yeah.
injuries are primarily myocarditis, basically, and it happens super rarely, and it's temporary. And then on top of that, like if you are worried about myocarditis, it's way worse when you actually get SARS-CoV-2 an infection, because there's more viral particles in a SARS-CoV-2 infection than there is the small amount that are delivered through RNA in the vaccine. So the vaccine side effects are just, for healthy young people, they're nothing, basically. It's nothing to worry about.
Yeah, and it's definitely not something that I'm worried about.
Yeah.
I guess trying to land the plane. I'm sorry, guys.
No, you're fine. You're fine.
I am trying to figure out what my argument, what my points need to be going into this visit this week, to combat what I feel like he's going to, what arguments or points he's going to bring up based on our appointment 3 months ago.
Yeah, I'm with stars on this one. I would honestly just get a new PCP, like, because you can't trust him to follow medical advice and any other thing. Basically, that's the thing that I would be really worried about, is trusting him to. Yeah, exactly. You could just get it yourself and not believe him, but then everything else that you hear is kind of like an asterisk thing. Or you just get a new doctor, because if they're not going to follow medical advice on this, I wouldn't believe him on anything else.
I understand that. That would be ultimately what I would want to do in the long term. However, I do need to go to this appointment this week for other reasons. And yes, I'm in Kentucky. So yes,
oh shit, and it's even worse. Oh my gosh, so that's
it's
one
a
of
red
the
state with a blue governor.
That's the one that's like the. Let me check. It's really hard to. They made it purposely very difficult.
I think we're gonna have to have a prescription.
Yeah, exactly.
From what I've read. So
and real quick, I'm sorry, I have to address this, but David S. Call me crazy, but I'd rather have COVID than myocarditis. Again, you didn't understand what I was saying. You get myocarditis from COVID. That is, you get it from COVID, and it's even worse with COVID. So if you're worried about myocarditis, it's TIS, by the way, not TUS. You get the vaccine. So I'm sorry, I just have to address the misinformation before you go. So unfortunately, they're basically trying to make it prescription based or even ban it in some states, which is absolutely insanity.
Yeah. So I'm not trying to give out too much of my health information, but according to the CDC, their approved medical conditions, I have 3 on the list of what they're saying. Hey, if you're under 65, you need to have at least one of these that are on the list of approved medical conditions to have in order to go ahead and get the booster for this year. So I'm hoping that I'll be able to say, hey, look, based on what they're putting out here and based on, what guidelines I guess he's going to be going by, it would make sense, going off of the checklist that the CDC is putting out there. I have conditions. And I'm someone who suffers with migraines. So I've heard you talk about long COVID having neurodegenerative effects.
Neurodegenerative, yeah.
And so I guess what my question is getting the COVID vaccine reduces the viral load, correct?
Yep. Correct. It creates the antibodies that are going to be able to keep your viral load down, and that decreases your chance and the severity of COVID-19 symptoms.
Okay, so a smaller viral load reduces my chance of infecting others. Correct. And
Correct.
then would it also reduce my chance of developing a serious case, and then therefore reduce my chance of developing long COVID?
Yes, exactly.
Okay. Okay. Um, I think that was all that I had. I'm trying to get my ducks in a row and get my argument really well formed so that when I go, and I know end goal, yes, don't want to have him, does not seem like he is aligning with me to be someone I want on my team long term. But for the short term, getting in getting in with a new primary is going to take me a while, and it's going to take me longer than what I need to go see a primary about in the short term. So I do understand everyone's position
Yeah.
and agree with them. It's time to find a new doctor.
Yeah, unfortunately, it seems like that's the case. David S., I just wanted to, if this is a good faith question, then you haven't heard anyone that's developed myocarditis from COVID-19. Here's from the Myocarditis Foundation itself. So, according to reports from 2022, myocarditis occurred in approximately 450 cases per million COVID-19 infections among males 12 to 17, compared to roughly 77 cases per million after receiving a second mRNA vaccine dose, with young males identified in the same group. So it's 5.5 times more likely that you have myocarditis from COVID-19 than you get it from the COVID vaccine. So it is absolutely true. Just because you have not heard anyone with COVID-19 that has myocarditis, they don't know that we have studies and science in order to prove and understand the world, and the reports, peer-reviewed articles are all on me with this. So unfortunately, I understand how hard it is to get an appointment and stuff. So it's you can't just necessarily jump into like a new doctor, but
Right.
it's just
Right away.
I wouldn't even. Is Kentucky one of the states that requires a prescription?
I'm pretty sure. Jen said, your mod, Jen said Indiana, which is a close enough drive that I could definitely hop over the river and do that. So that might be another option, and not have the conversation with him at all, because I'm not somebody who really likes to have like confrontation if I don't have to.
Yeah, you don't have to.
So,
Yeah, this isn't up to you. Like science is what it is, and you don't need to fight this guy. He's wrong, and it is what it is, and I wouldn't even. Don't even worry about it. This guy is wrong, and he's so thick-headed, and he doesn't care about his job enough in order to inform himself. So it's very frustrating. It's very frustrating that someone could be like that, but it happens.
It really is. And he's been practicing. I mean, he's not a young doctor. He's probably really close to retirement.
Yeah, there you go. Yeah.
Yeah, I was really disappointed when he started talking, the way he did about 3 months ago. It just, and I do live in a larger blue city, and I know not everybody in the city is left leaning, but it's just surprising when you come across someone who, especially in the medical field, who is that way. So I just really appreciate your knowledge, and just can't thank you enough for what you've done. I know you're fairly new, and I hope that this channel grows by leaps and bounds, because you have a lot of good information.
Thank you. I appreciate that.
Yeah, you're welcome. please kick me because I don't know how to
Yeah, no
leave
problem. Hey,
myself. Yes,
when you get vaccinated from the COVID, come in here and we're gonna throw you a vaccine party and we're gonna celebrate you.
I'm going to. Hopefully,
Nice.
if they've got the flu shot, I'm gonna go ahead and get the flu shot.
Yes. And anything
If
else,
Walgreens
honestly,
or whatever,
MMR, Tdap, anything else that you don't have a vaccine card for, and your
got those
immunization
last
card,
year.
like just see what you can get.
Yeah, I did Tdap,
Nice.
and I think MMR last year because I needed to be updated on those. But I will come back in the next day and we'll have a vaccine party. Absolutely.
Nice. Let's go. Let's go. Christy, thank you for taking and fighting for yourself and fighting for your own health. I appreciate it, and you're doing your own research in the right way. You know what I mean? And I think that that's the biggest part.
Well, that's what we all got to do. We got to advocate for ourselves, and gain the knowledge that unfortunately it doesn't seem like right now our government is giving to us. So
Yeah. Yeah, I agree. All right. Well, I look forward to talking to you soon. Okay.
yeah, you too, and thank you so very much.
All right. Thanks, Christy. Have a good one.
You too. Bye.
Yeah, David S. I've gotten tons of flu boosters too, bro. I've gotten COVID boosters. I've gotten flu shots. I've gotten tons of vaccines, man. It sounds like you're just scared and you're living in fear. You're living in fear of a simple shot, and you need to get over it. Stop being a wuss. I have a PhD in microbiology, so these people are my peers, and especially if they're using anti-scientific pseudoscience, this is absolutely in my wheelhouse, bro. Leonard, how's it going? Okay. Susie, did you get vaccinated recently? Susie, what's up? How's it going?
Did you literally not see the video I made?
What
My
happened?
son was pumped. He wanted me to share it because he had heard you talking about vaccines once upon a time. I don't know
Uh-huh.
when. I'm sure he was supposed to be sleeping. But he's big on like trying to stay up with that. He's 10, okay?
Okay.
He wanted me to record it and
Oh,
like so I could show people. So I thought I tagged you in it.
dude, no
And
way. I'll have to see. I'll have to see. David S, bro, you're the pharma shill, bro. You realize the amount of money that is not given to pharma companies because you don't stay in a hospital. Like the pharma companies make way more money from a hospital stay from a disease than they do with a vaccine, bro. You're literally for pharmaceutical company profits by being anti-vaccine. So we're for a $10 vaccine versus $1,000 in the hospital, man. I'm sorry, but you can do that math probably. Maybe, I don't know if you can. Susie, yeah, I didn't know. That's so cool.
yeah, he was pumped. We went to get batteries at Walmart,
Uh
and
huh.
somehow ended up getting vaccinated for the flu. He wanted to, and
No
he was
way.
pumped, and he was excited, and he was like, you would have swore like
Did
I
you
was
did you get
questioning,
vaccinated
like,
too,
yeah, because he
dude?
was like,
Let's
I mean,
go.
so like in the video, like if you go, like like it's there. I like really condensed it, clipped out a lot, and like just like fast forwarded it a
Sick,
lot so you could see it. But he was so excited, and he was like very proud of himself, and he wanted to make sure everybody knew that he did it. So I know that you
dude.
don't share
All right,
like my
Susie,
children. Yeah,
Susie, and her kid and her boy, 2 vaccines, guys. Let's go. Woo! Good
and
job.
it was free.
Nice.
It was
Double
a
double
free.
V's. Double V's. Good job. Susie, good being a good mom, getting her kids vaccinated. That's
I
what we
feel
like
like
to
my
see.
child was being a good like role model for me because
Let's go.
he's like,
Let's
Mom,
go.
because I'm
Every shot.
immunocompromised.
Every
I'm
shot. Every single
immunocompromised, and he
time. Good
wanted
job,
me to
guys.
like not get sick.
Yeah.
And so he's like, Mom, come on. you know, you're gonna
Nice.
get sick, and like maybe this will help you not get as sick.
That's
I'm like, yeah,
awesome.
that's legit logic. Okay. He's like, I'll go
Yeah.
first. I'm like,
Nice,
okay.
guys. Dude,
He
that's
did
awesome.
great, and he was very proud of himself, and he wanted other people to be proud of him, and he knows that there's other kids that
Mm-hmm.
are fearful because people, you know, some kids are just have always genuinely been scared of shots. And one, he doesn't seem to believe they hurt.
Let's go,
Two,
Stars. Let's go. Let's go. Nice,
uh,
dude. I think.
I think it's like, oh, I'm sorry, I'll quit real quick.
Yeah, go ahead.
Oh no, too, like you know, he knows he's very aware of, you know, I don't even want to say the word to get it started, but of the very hot topic that's consistent here. And he was vaccinated as soon as he could be, and he
Nice.
was,
Good.
you know, you know, there are certain things that are absolutely important, and the loss of my child's life is not something I'll gamble with.
Yeah,
Not when it's
exactly.
something that and my daughter had gotten RSV as an infant, and that was terrifying.
Oh my gosh.
Never,
Yeah.
there's no Russian roulette with that.
Yeah, exactly.
So my son has been proactive since his sister got sick as an infant.
Dang.
So anything, and he's going to be a doctor who's an astronaut and buys me a planet. So I'll do whatever he says so I can get that planet.
All right. Nice.
But
Cool.
yeah,
I wouldn't get
we did it
an
yesterday.
untested emergent vaccine in me. Not safe. No party could make me take any jab. Okay, Margin, I'm sorry you feel that way. You can request if you want to talk, but that's not what we're talking about here. You've been fooled by propaganda, and I'm sorry about it, but vaccines are safe and effective, and they're really important to get. So it protects you
Yeah.
and the people around you. So just like
And
Susie was talking about.
he's running for class president, so he
Hey,
said he had
Marissa.
to stay healthy.
Yeah, exactly. Got to advocate for one another. Public health is
he,
important, guys.
he totally
What's
said
up,
he was going to say
Mrs.
that in his
Dr. G's in
speech.
the house? What's up? How's it going?
But yeah, so yeah, I just wanted to come really quick to. I thought you had seen the video. I'll run and tag it again. I
Okay.
don't care if you share it. I don't know if you do that or not, but you can show. My son's proud of himself, and he wants people to know to do it. It's safe. He's fine.
Okay.
He doesn't have a fever. He doesn't have a sore arm. He's good.
Okay. Yeah. Yeah. It's only for like a day, and you're fine. Yeah.
Yeah,
Exactly.
he didn't have it. He was ready. He was fine.
Nice.
So,
Sick.
but yeah, it was just yesterday. Just went to get batteries and left with the vaccine.
Nice.
Forgot
Cool.
batteries, had to go back.
It means you've raised them well. That's good. That's really good. Well,
Well,
good
I
job,
will let
Susie. Good job,
people
Mom.
come back up. Thank you. I'll let people come back up for dialogue. I'm gonna sit back and listen and not
Okay.
fall out of my chair.
Me too. Me too. All right. Well, have a good night. Thanks for coming in. I appreciate it. And good job,
Yeah, I'll
Mom.
be
Getting
around.
moms getting their kids vaccinated. That's what you like to see, you guys. Mom getting all the vaccines. No, they're all safe to get. You don't have to wait. There's no time problem. That's all been tested, guys. Every parent should get all their kids vaccinated. As a parent, there's very rare times where you know that you're doing 100% the right thing. All parents know this. It's very hard to know when you are doing the 100% right thing for your child at any given moment. Getting them fully vaccinated is always the right decision. Every single time. Every single time, guys. All right, Leonard has some anti-vaccine stuff apparently that he wants to talk about. So here we go. Leonard, what's up, dude?
How you doing, man?
Good, good. Why are you so triggered?
What? I'm sorry.
Why are you so triggered?
I'm not. I don't know. I'm not triggered. I was just doing some research after like we talked about vaccines and stuff,
Okay.
and I was just wondering, do you think?
I can't. You tabbed out. I can't hear you when you tab out. There
I'm
you go.
sorry.
Yeah, you're back.
Have you? Do you think that Pfizer and Moderna have been caught manipulating studies and research to fit their own agenda or profit gain?
I mean,
Because
historically, are you trying to lampoon the entire vaccine industry based off of one bad
no, no,
actor?
no, no, no. I'm not trying to lampoon the entire vaccine industry, but
It
what
sounds
I
like
am
you
trying to
are.
say is, if you look at Pfizer's revenue in 2021 and 2022,
Yeah.
you see that they had over 1,000% increase in
My
revenue
God.
and profits.
Oh my God. That changes everything.
But wouldn't it though? How
No.
would it not?
No, dude. Dude, do you think naturopaths are for profit? The
I
people
think
that are selling you green tea for $100 a month instead of vaccines, do you think that they're for profit?
um yes,
Yeah,
probably.
yeah, yeah. Okay,
Yeah.
so now like the profit margins of green tea for $100 a month versus the vaccine industry, what do you think is a higher profit margin?
Probably you're probably getting to the green tea.
Yeah, yeah, bro. Yeah,
Mhm.
and guess what? And the green tea does nothing, and vaccines actually solve a problem. So that's the difference. Is that you can? I'm sure there's some bad actors in there, and honestly, that's a system that's working well, right? Because we know that that's happening, and it's been exposed, and you have it, and you can Google it, and you can find those things, and that's fine. And
What if
but guess what,
what if in
dude?
10 years like it
Bill Z,
usually
no,
is,
that's
like the
not true. That is
opioid
not true.
epidemic?
It is not profitable. Vaccines aren't super profitable. Johnson and Johnson actually stopped producing their vaccine because it was the profit margins were so low. So we don't need a documentary, Miss J,
But
forever.
if you
We can
but
look at
if you look
studies
at
and we can look at science.
yeah, but if you look at Pfizer's profit, they profited highly off the COVID vaccine. Like you could do your own research
Dude,
on
no,
this.
oh, no, no. You're talking about the profits in 2021 of Pfizer as a company, which all the biotechs did well. Do you remember the stock market in 2021?
Yeah, it blew up. Yeah.
Yeah, so
Hmm.
all of these companies are going to do well. So what you're doing is you're attributing all their stock market gains and all the profit they've made on that, yeah, because of the stock buybacks and all that kind of stuff to just vaccines, bro. Like, give me a break. Come on, look
Okay,
at every
so but
company.
wouldn't you agree that if somebody is caught lying for like over and over and over again, you lose credibility as a company or as a
No, they're
doctor?
big,
Like
dude.
say
They're
for
so
example,
big, man. Like, what do you? Wait. So you're thinking that you're gonna listen. Your atonement is lying, and you're gonna go with people that are anti-vax. That's who you're gonna side with.
no, I'm not siding with like I've taken vaccines before. I'm not saying
Okay.
I haven't taken vaccines. I'm still very skeptical about the COVID vaccine. Even
Okay.
though there are studies to prove that it does work. Who's to
Okay.
say who's to say in 10 years like the opioid epidemic when that all happened that after 10 years, 15 years of when they were
It
prescribing
does work.
opioids to people who didn't need them and then all of a sudden they become addicted to them and then pharmaceutical companies try to hide that shit.
Bro, that's not how it works. It's because opiates have an addictive property to them. Vaccines aren't that way. We go to vaccine shots every year because that's when the antibodies go down, and during a pandemic you want to change the sequence of the vaccine so that you can better align with the current sequence that is out there because it's a pandemic and it's constantly changing. It has nothing to do with like some yearly subscription cost. And if you actually cared about not giving pharmaceutical company profits, you would be for vaccines because the Pfizer and all these other companies love when you go to a hospital stay. You spend way more money when you're in the hospital. You spend hundreds of thousands of dollars in the hospital if you're in one of these infectious diseases. It
Then
has
why
not
would
injured too many. That is nonsense. That's
Pfizer make a vaccine then if it's more profitable? Why would they even bother making a vaccine if hospital visits are more profitable?
Exactly, dude. Exactly.
Yeah, exactly.
Because not everyone in the world, you are projecting your own love of like the idea that everyone in the world has to be this greedy, gluttonous like monster that is the only reason why anyone does anything for the profit motive. It's because vaccines are needed and governments pay for them and they want them because it's good, because the government saves the government's tons of money, because people aren't in the their economy is doing better because they're not injured through infectious disease, and people actually want to go out and spend money and go to concerts and everything else. So it's beneficial for the government to pay and subsidize for these vaccines. So it actually helps their economy. It helps their economy, like more people participate.
Would you say that Pfizer is for profit? Like that's
no shit,
like
dude. What? You don't think? Of course they are. What are you talking about?
Of course they are, right? So
Yes.
Exactly.
You think
my
that is
point. That's what
that is
they're
your
thinking
epiphany?
about.
That is your epiphany that Pfizer is a for-profit company?
No,
Come
but
on, bro.
But like,
Come on.
But the more you do evil shit to people into the
Yeah, you know who's doing the
population,
evil
more
shit to people is the people that are pushing misinformation and vaccine hesitancy that you have bought into. Those are the actual people that are wrong, because they've polluted your brain, bro. That's the people that have
I'm
actually done really bad things in the world. So it's not the people that are trying to help people and try to inform public health. It's the people that are actually pushing this disinformation that you've sadly bought into.
But I wouldn't say like I'm necessarily pushing disinformation about vaccines. But
You're
what I am
misinformed. No, you're a victim. You don't know what the difference is, but you have unfortunately bought into propaganda from people that are pushing disinformation.
Okay,
From RFKs and all these grifter physicians that don't actually care about the patients. They want to try to swindle themselves into a position of power.
Okay, I understand. All right, so you said prior to our talk, you said approximately what? You said 1.3 million people died of COVID.
Yeah, 1.2.
Right? 1.2 million. I looked up when we got off the phone. I looked up how many people die of obesity each year,
Yeah.
and it is 500,000 people each year.
Okay.
But I don't see the government coercing people out of jobs to eat
Bro, they're
less
literally
food.
trying to fund fucking GLP-1 agonists and Ozempic for people and Medicaid and Medicare so that they can not be obese. Like, people are trying to do that because it is a huge quality of life thing. And the difference is that obesity isn't spread like a communicable disease, like a respiratory virus is. So you don't
think the
spread, you
food
don't
we're eating
don't
is
rub up
addictive?
against someone and then you get fat.
Yeah, but so you don't think the food we're eating in America is addictive?
Why are we popping on this? Why are
Because
you
it's important,
popcorning? Why
because-
can't you stick on one subject? Why are you
No,
trying to popcorn around?
We could stick on one. I don't mind going back to what we were
But
talking about
no, dude. I
prior.
mean, the idea that our food is poison is nonsense too, man. It's all this maha shit that has polluted your brain, dude. It's not true. I'm sorry. Like, there's poor nutritional value in processed foods. That's an argument that's fine, and people are overweight because they overeat calories because of readily available processed foods. That's an argument that you want to have. That is totally fine, and that's fine. But preservatives aren't poisons, guys. Genetically modified foods are not poisons. Like, food dyes are not poisons. I'm sorry.
No, the thing I was comparing to that is the case in where the government wants to be in your life with coercing you to do things that you do not want to do. That's the case I was making. I was making the case that they were coercing people to get the vaccine or you're out of work. But you don't see the government coercing people to eat less food because it's not profitable.
Bro,
because
like,
it's
what are you
just not
talking about?
profitable.
What did you think the entire? How old are you? Didn't you see the Michelle Obama My Plate initiative? They were trying to redefine what a healthy plate is of food and tried to redefine what you actually should eat per meal. And the Republicans excoriated her and the entire Democratic Party for actually wanting kids not to be obese as childhood obesity. I know it's
But
it's
I don't
crazy.
think that this
Did
is a
you support? Wait, did you
Republican-
support that? Did you support Michelle Obama's initiative to cull childhood obesity?
Yes, I support it, but it
Okay.
didn't work.
Because it was gutted, bro. Like, what are you talking about? It was there for a couple years. Like, what are you talking about? As soon as Trump came in
Yeah,
office,
I'm not-
he changed it. Yeah. So
But-
yeah, childhood obesity isn't one night.
Yeah,
like, what shit
I
are you
agree with
talking
you.
about?
No, yeah, I agree with you, but I'm not ma- I'm making the claim that this is not a Republican or Democrat thing. This is
Yes,
a
it is, dude. Yes, it is.
capital.
Yes, it
How
is.
is it a
No, stop
Republican or
it.
Democrat
Stop.
thing?
Stop. Maha and this disinformation bullshit that Trump has ushered in with RFK is strictly a Republican problem. So don't give me this bullshit both sides thing. No.
But it is both sides because
No.
everyone
No,
has a
it's not.
price.
No,
Everyone
you have
gets
no idea what you're
paid.
talking about, and you're just spewing more nonsense out of your mouth right now.
But how am I spewing nonsense when I haven't mentioned Democrats or Republicans one time?
Because
I've
because
mentioned
both because
data.
RFK and Maha are the place where all this nonsense is coming from. This nonsense about our food being poisoned, this nonsense about vaccines being dangerous, nonsense about vaccine injury, this nonsense about 1.2 million people didn't die. It's all wrong, dude, and it's all coming from the Republican Party.
But I'm saying like, but okay, that could be coming from the Republican Party.
It
Okay,
is. It firmly
but
is.
okay, but um, what I would say to that is that how is this a Republican or Democrat like actual thing? Like maybe this specific thing may be okay. I'll
Yeah, that's
grant
what
you
we're talking
that.
about. This specific
I'll
thing, and
okay.
it
I'll
is a
concede to
Republican
that. I'll
problem.
concede
Yeah.
to that, right? But
Okay.
I'm sure. But I'm sure that you can find out Democrats that pushed opioids to the entire population
We're not
and
talking about
funded
that, dude.
those
That
things.
is
I
something
know, but
that's
I'm
fine, and
comparing
that
the
is a
two.
problem, and I'm totally okay with that. Like being, well, the profit incentive of why these physicians are pushing that thing, and why they would want that. That is fine. People being pushed into addiction, and that, dude, that is what people in the Democratic Party push for. That we should have some health care to let people land on their feet, some safety net to allow people to not get chronically addicted to drugs. Again, that's a Democratic Party issue. If you actually cared about healthcare in this country, you'd support the Democratic Party. The Republican Party has done nothing for that, not a single time. So
Okay,
again, dude,
I'm not saying that you are wrong. Okay, all I made was I compared the two. So I compared the skepticism that I have with the COVID vaccine. Okay, and then I compared opiates. Okay, I'm sure you can find corruption where Democrats funded the pushing of opioids to people to put money in their pocket, and I'm sure you can
do you
find.
think that this vaccine hesitancy exists throughout the entire world?
I don't know. I can't say that I do
It
know. I
doesn't.
do not
It
know that.
doesn't, bro. It's uniquely a UK and US problem where we allow these types of nonsense, and we coddle these anti-vaccine beliefs and these people that are pushing disinformation, and be like, not you, man. Like, I think that you are one of the victims here, and I will talk to you for the next hour if you want to go through all this stuff. But I'm telling you that, like, the people that push this stuff, because people conflate liberty and freedom with anti-intellectualism and no expertise. Like, people like in the chat legitimately do not think that you can have expertise on an issue. That there's
No,
nobody
I
that
think
can
you
know,
could.
and they can literally find the answer within Googling, for 10 seconds, and they can understand more than a medical professional that's trained for, a decade, giving their lives to be a physician. And that's just not true. So
Yeah, yeah. You're probably very good at what you do, and
I'm
I
not a
do not
medical
think.
professional. I'm not a medical doctor. I'm a PhD in microbiology, which it actually is wildly even more in the wheelhouse of actually the pandemic, because of the SARS-CoV-2 and virology and immunology and epidemiology and this population genetics, and I kind of probably know more than a medical doctor in a weird way because of that.
Mhm.
So, but I'm a science doctor. I'm not a medical doctor.
Yeah. So, um, my next question for you is that these nonprofits, right? Like, say, like, because you were talking about the billionaires, right? And which I do agree with you on that. That a lot of these billionaires are pretty fucked up, like Peter Thiel. I saw one of your videos on Peter Thiel. That dude's a pretty fucked up dude. Just how he speaks, honestly, and the way he speaks and what he talks about is very weird, and I get sick to my stomach almost because he talks about some crazy shit.
I agree, man. I
Um,
agree.
but also
Peter
because
Thiel.
yeah, yeah, because I try to be very neutral, even though everybody has a slight bias in things. I try to be neutral with what I see and what I learn. And I do like some Democrats. I do like some Republicans. I'm not one side or the other, honestly.
The-
Maybe I do lean a little right, but what I would say is like when I see like the Bill and Melinda Gates Foundation like funding all these studies when
because the return on investment is so great for vaccines, dude. It's insane. Like it's exactly what I was talking about before, where a hospital stay is like 1,000 times more expensive than a simple vaccine, and you can actually save people's lives with vaccines because they're so safe and effective. So yeah, of course they're going to. And Bill and the Melinda Gates Foundation does great work, man. They funded some of my stuff, my research myself. So it's like they do great stuff.
But I don't think he does. Have you ever seen his TED Talk?
Yeah, with malaria.
No, 10 years ago.
Yeah, he released the mosquitoes inside the room.
Yeah. Okay. So on how he says that, he literally says this verbatim. You could rewatch this if you
Yeah.
want, but he says that, he wants to decrease the population with vaccines. You could literally watch the TED Talk, and he says it verbatim.
Okay, let's watch it. Let's watch it. Bill Gates TED Talk, reduce population through vaccines. Let's watch it.
You probably find it on TikTok, honestly.
No, Bill
or YouTube.
Gates does not plan to depopulate the earth with vaccines. That was the first thing that comes through.
Yeah, I know, but you got to watch the TED Talk with context.
Okay, innovating to zero. Okay, let's watch it. No, this is the exact same thing that I watched. Well, it's a 27-minute thing. Let's look through the subtitles. Okay, so I have the transcript coming up. So what do you say? Reduce the population?
Yes, something like that. Yeah, within those lines. Yeah. I watched it years ago, though.
Oh, okay, so you don't understand either. First, we've got population at 4 minutes. First, we've got population. The world today is 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job in new vaccines, healthcare, reproductive services, we could lower that by perhaps 10 or 15%. But we could see an increase by 1.3. So he's talking about
decreasing the population.
No, dude, he's talking about carbon dioxide. He's saying carbon dioxide emissions.
No, he's
saying CO2 is warming the planet.
I'm telling you.
Yeah, he's saying CO2 is warming the planet because medical care costs CO2. That's what he's saying at 2 minutes. Now, do you want to read the entire? I'll read the thing to you. I can just read it to you. I'm going to talk today about energy and we're going to read the whole thing. I'm going to talk today about energy and climate, and that might seem a little surprising because my full-time job at the foundation is mostly about vaccine seeds. But the thing that we need to invent and deliver to help the poorest 2 billion lives be better. But energy and climate are extremely important to these people. In fact, more important than anything else on the planet. The climate is getting worse. Means than any years their crops won't grow, but there will be too much rain, not enough rain. Things will change in ways their fragile environment simply can't support, and that leads to starvation. It leads to uncertainty. It leads to unrest. So the climate changes will be terrible for them. Also, the price of energy is very important to them. In fact, you could pick just one thing to lower the price to reduce poverty. By far, you'd pick energy. Now, the price of energy has come down over time. Really advanced civilization is based on advances in energy. The coal revolution fueled the industrial revolution, and in that 1900s, we've seen a very rapid decline in the price of electricity, and that's why we have refrigerators, air conditioning. We have modern materials to do so many things, and so we're in a wonderful situation where the electricity in the rich world. But as we make it cheaper, let's go make it twice as cheap. We need to make a new constraint, and that constraint has to do with CO2. CO2 is warming the planet, and the equation on CO2 is actually a very straightforward one. If you sum up the CO2 that gets emitted, that leads to a temperature increase, and that temperature increase leads to some very negative effects. The effects on the wealthier, perhaps worse, the indirect effects in the natural ecosystems can adapt to the rapid changes, so you get ecosystem collapses. Now, the exact amount of how you map from a certain increase of CO2 to what temperature will be and where the positive feedbacks are. There's some uncertainty there, but not much. Now there's some certainly uncertainty about how bad those effects will be, but they will be extremely bad. I asked top scientists on this several times. Do you really want to get down to near zero? Can't we just cut it to half or quarter? And the answer is, until we get to near zero, the temperature will continue to rise. And so that's a big challenge. It's very difficult than saying we're in a 12-foot high truck going under a 10-foot bridge. Can we just get it under the bridge? This is something that has to get to zero. Now we put out a lot of carbon dioxide every year, over 26 billion tons. For each American, that's about 20 tons. For people in poor countries, it's less than 1 ton. It's an average about 5 tons per person on the planet. And somehow we have to make changes that will bring that down to zero. It's been constantly going up. It's only various economic changes that have been flattened at all. So we have to go through rapidly rising to falling and falling from way to zero. This equation has 4 factors, a little bit of multiplication. So you've got a thing on the left, CO2, then that'll get to zero. That's going to have to be based on the number of people, the services each person is using on the planet. The energy on average for each service and the CO2 being put out per energy unit. So let's take each one of these so you can see how you can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra, but let's take a look. First, we got population. The world today is 6.8 billion. That's headed up to 9. Now, if we really want to get a good job in vaccines, healthcare, reproductive services, we could lower that by 10 to 15%. But you'd still see an increase by about 1.3.
10 to 15%.
No, he's talking about the CO2 emissions, bro. What are you talking about? Did you just white out for the last 10 minutes when I was reading that, and then you just came in at the last second?
No,
and just thought,
no.
What did you?
I heard what you were saying.
No, you didn't. You didn't, dude. I just sat here and read you the whole thing, and I was telling you exactly what he was talking about. He's trying to get the CO2 down, and he's saying that because of the energy costs from the pharmaceutical interventions from vaccines, you don't have to have that. Like, what are you talking about?
Reread that section. Reread the last 4 sentences that you just read.
Bro, you're not in, dude.
I'm being genuine about this.
No, dude. Like, holy shit, dude. Like, your brain broke, man. Like, what is wrong with you? No. I literally just spent 5 minutes reading this whole speech, and you just blacked out the entire time, and then you snapped into place in the last sentence, and then you said, he said decrease it. He's saying decrease it by the amount of CO2 per person. What are you talking about?
All right.
He's saying, dude, are you out of your mind?
I know the context.
Dude, this is why, guys. This is why we have to get. These are the things why disinformation is so bad. People like this will just come in at the end and hear what they want to hear. This is unbelievable. I've never experienced this in my entire life, dude.
It's not like I don't know what he was talking about. He was talking about CO2 emissions. I know that.
Okay, what did he talk about? Reinterpret the speech to me.
He was talking about lowering the CO2 emissions. I don't really know everything, but I know.
Bro, there's 10 paragraphs, and that was it. You got one sentence. You got one sentence out of it.
Because he literally said decrease the population. Did he not say that?
No.
Did he not say decrease it by 10 to 15%? Read
That's
that
up to 9. But now we really got new vaccines. We could lower that by 10 to 15%. We can see an increase by 1.
How can you decrease CO2 by vaccines? How is that even possible?
What? I just told you the CO2 output by actually saving people so that they don't have to go to medical interventions, and it's a lot higher CO2 energy expenditure when you're in the hospital. You're using this is what blows my mind. You guys think it's wild. You think that have you ever gone to the hospital ever in your life? Do you have any idea the energy and materials costs of people that are in the hospital? Maybe that is it. Maybe the anti-vax people have never actually encountered anything in the hospital or any type of medical service ever before, because you guys seem to think that it all works in fairy dust and there's no material costs or anything, because apparently pharmaceutical companies are just making bank on $10 vaccines that are like a 10% margin cost, but all these hundreds of thousands of dollars of services and materials that they're providing, that's just you just magically happen. Are you like, do you understand what he's saying?
Yeah, I
No,
understand
you don't understand what he's
somewhat of what
saying. You don't understand what he's saying. Why would
But
why would the CO2 output be more for a long-term like person with a disease?
you tell me.
I just explained it, bro, 3 times.
So you're saying with a disease, how much more CO2 do you release when you have a disease?
Because you have to go through health services. Yeah,
Oh,
health
okay.
services.
So do you think? All right. So you're saying that what percentage of CO2 do hospitals or do people release when they have a disease? Is it even comparable to how much CO2 is released by other aspects of life? What? Why are you getting so triggered, man? I'm just trying to have a conversation. I'm trying to learn too, man. Like you're a smart guy. I'm not saying like you're a smart
Holy
dude.
shit,
I'm
dude.
just a
Holy
skeptic.
shit, dude. I know.
It's
And you
good
don't think
having
that
these
scientists, the
conversations.
problem with you and the problem with people like you, man, is that you don't realize that scientists are the biggest skeptics, actually. We think nothing except for skepticism about our own results, about like the studies that we hear. That's why we read constantly. That's why we're constant learners about what new techniques people are using, what's going on, like why, how you can prove things. Like in science, in order to prove something, you don't prove things one way. You have to prove 3 different ways so that you know that they're not actually conflating one another. That's how science works, man. So like the idea that you are just bringing this skepticism that I'm like, oh my God, I've never been skeptical before. Oh my God. What you're doing is you're being a contrarian. That you were expecting someone to just spout that, and to me being like, oh, okay. You didn't expect me to sit here and read this for the last 5 minutes. And I did. And it's exactly what he was talking about. He was talking about climate change the entire time. And now you've somehow misinterpreted what he said, and now it's on
But
me. Now it's my fault because I read
I
you something and you
legitimately.
couldn't understand what's going
Oh,
on.
okay. I could have misinterpreted what he said, but I
Yes,
really.
yes, dude. And okay. And so again, why would you listen to a
But
TED talk?
if you
Listen,
read.
why listen to me? Why would you listen to a TED talk about Bill Gates about climate change 15 years ago on whether or not vaccines are safe? What would that possibly
But
inform you
he's
about the safety of vaccines?
because he's direct because when he said that and when he inferred that he's directly talking about the population, is he not? Is he not talking about the population? And then
No, he's talking about CO2 per
after he mentions the
person.
population, he says decrease that by 10 to 15%. Did he not say that? Or am I tripping out right now?
You are,
Because I
bro.
swear
You
I
are
thought he
complete,
said that.
dude. You're gonna have to reread. You're gonna have to reread this. Watch this. There's a check my link tree. There's a YouTube live. You can watch this thing again. Like I don't understand. Like he literally talked 4 paragraphs about it. Like I don't understand what you could possibly be. You're like, bro. Like what are you talking about? And why would you think about a 2010 TED Talk as your main source of whether or not vaccines are safe? Why aren't you reading the Pfizer and Moderna studies? Have you read those? Pfizer.
But
No,
why would
listen to
you?
me. Have you read
Wait.
that?
I have a question. Can I have a question for
No,
you?
answer my
Why
question.
would I read
And
Pfizer
listen.
and Moderna studies that are making the
So you haven't read
vaccine
the
and
primary
making
literature
money on the
about the book.
vaccine?
So you basically have not done the homework on the exact thing that you're trying to talk about, and you're trying to talk like an expert. And the reason why, bro, the reason why the study isn't done by Pfizer. That's why. It's done by independent scientists from the CDC
But
that are MD PhDs that are trying to understand whether or not this is a safe vaccine to administer. It's not
but
done
do
by Pfizer, bro.
do Pfizer and Moderna not fund the studies?
Yes,
Do they
of
fund
course,
the
because
studies?
they're a for-profit company. So yes, they're going to be paying for the profit for it to be
So
done.
that means that they could possibly manipulate data and tell
No,
people
no, that's
bullshit.
not. No, you're not. You didn't. again, bro, you have a listening problem. You genuinely do, man. I don't know if you're paying attention on your phone or like you're watching TV or something. You need to like lock in here, bro. I seriously, the last 2 sentences before that, I said they are private for-profit companies and they don't run their own studies. Independent scientists, MD, PhDs are doing that. And they run and see if the vaccine is safe and effective, and the CDC puts it out. It is not done by Pfizer themselves. Pfizer scientists are not running their own studies.
Yes, I know that they're not running their own studies.
Then why'd you say that?
No, I'm not saying they're running their own studies. I'm saying they're funding the studies.
Yes,
That's what I
because
said.
they're for-profit companies. So yes, they're going to be able to go and they're going to make money off of their product. So yeah, they fund it to make sure. And by the way, a lot of the original funding to make sure that the seed funding on a lot of this stuff, so that it goes really quickly, it was actually funded by Operation Warp Speed. Have you done any research on Operation Warp Speed? Or are you going to 2010 TED Talks in order to understand how vaccines work?
No, I'm just watching different things, and I'm just trying to connect the dots.
You are slurping at the spigot of disinformation, bro. That's what the problem is.
But if you run a business, right, and you're funding something, and you want something to go well, and say that study doesn't go well.
Yeah.
And would you, as a company, and if you can manipulate it, would you to profit more? Yes or no?
Bro, that is not how...
You would.
No, that is not how it works. The independent science, the CDC is going to publish that data, and they're not going to recommend it. The FDA is not going to recommend your product for trials. So the FDA doesn't pass a lot of stuff, dude. Do you realize that how cautious the FDA is in the United States? They do not approve a lot of stuff in the United States, but it is approved and through the globe. We are notoriously extremely cautious. The FDA doesn't blanket approve things just because a company is willing to pay for it.
But the FDA allows companies to sell cigarettes that kill hundreds of thousands of people each year, right? It's so easy to see that shit. Like, cause it's money. That's what it is. That's the core of everything. Money.
So because cigarettes exist, you're not going to trust vaccine studies?
No, that's not what I'm saying.
That's what you're saying. That is what you're saying, bro, because the FDA lets cigarettes be sold with all the warning labels as if there's not warning labels everywhere on cigarettes. Famously, there's no warning labels and nothing is told to you when you're buying cigarettes that it's bad for you. The fact that it's there, it lampoons the entire FDA, so you don't trust them enough in order to trust vaccine safety.
You're deflecting my argument right now.
I'm engaged exactly with your argument. You just haven't thought through your own argument, and I'm there with you, bro. So we're going through it together. We're going through it for the first time, and it's okay. You haven't thought it through, but we're there. So the FDA, yes, they allow cigarettes, bro. And it's I think you're making a good point. Maybe they shouldn't allow it. Would you support them banning it?
Absolutely. Yeah, absolutely. I would support them.
Okay, so banning. So you think that vaccine? Okay. So under that thing, that do no harm thing, you would literally allow vaccines to be sold. I mean, you'd allow vaccines to be made and sold. The FDA would do it, but the cigarettes that has no benefit and no actual tangible benefit to society, that would be banned. You would still, even under your own criteria, you would still have vaccines.
Yeah, I know, but I don't. Okay, I agree with you on that. Okay, I 100% agree with you on that.
Okay.
The thing that I just have a problem with is trying to spew through all the corruption everywhere, pretty much. And sometimes it's very tough, in my opinion, to find the truth and to not be manipulated by certain aspects of life, I guess, and certain things that are being pushed onto us. And I just feel like when you're being coerced to do something, when just as many people die of obesity each year to lose your job, I feel like there's something up.
Wow,
That's
wow,
all I'm
dude,
saying.
Craig. Actually, this is a really interesting. That in 2009, the Family Smoking Prevention and Tobacco Act was enacted, giving the FDA the authority to regulate tobacco products for the first time. The landmark law allows the FDA to oversee the manufacturing, marketing, and sale of tobacco products, aiming to reduce tobacco use and its devastating health consequences, particularly among young people. So,
Yeah, and now
I
it's
mean,
vaping. It's
well,
even better. Vaping.
bro,
I'm just saying.
but you realize that they literally, as soon as they could, they regulated as soon as they could. They had to pass the law. It wasn't, they couldn't regulate it before.
Yeah.
Yeah,
Okay. Yeah.
yeah.
Understand. I
So then
understand.
what? So then what does it have to do with vaccines again? I don't understand.
No, I'm not saying it has something directly. What I'm
Yes, it does,
saying
because
is,
you're saying that the FDA is corrupt, and you're trying to talk about the FDA being a fully corrupt organization. So you are talking
I'm
about
not.
that.
I'm not saying the FDA is fully corrupt. I think the FDA does help people. I think vaccines do help people, but I don't think they care more about helping people than they do care about profit.
FDA isn't
That's what I'm
profitable. FDA
saying.
is not a for-profit company, bro.
I'm not, but they get grants, don't they?
What?
Doesn't the FDA get grants
No, I don't think they did grants at all. No, the NSF, the
or
NIH gets grants.
subsidies?
The FDA doesn't like. No.
Are you sure? I don't know.
What?
I
What?
think
What are you talking about? FDA gets grants? That what for
I don't know.
grants are whoa, what? Bro, grants are given to universities and companies they're basically begging for money from the NSF and the NIH in order to fund research. So why would the FDA get a grant?
But has the FDA ever got caught getting paid off to um advocate or accept certain things that are not good for the American people? Like why does the FDA allow Chick-fil-A and McDonald's to put 150 ingredients in their bread? Because it's addictive. You could look at all the ingredients, and it's true though. I'm just pointing out
No,
the
dude.
corruption
No.
in
No, dude.
everywhere.
No.
There's
No,
corruption
man.
everywhere. And
Dude,
that's why people
dude,
are
but that's
skeptical about the vaccine.
no, they're
Because there's
skeptical about the
corruption.
vaccine because we allow and coddle disinformation in this country, and we've allowed these people to exist for too long with kid gloves without actually engaging with them and just taking them to task every single time that they spout their nonsense. That's the reason.
Yeah, but like I told you before, like I get the flu shot every single year. Every
O-
year.
Okay,
Okay?
okay. So then why not the
And
COVID booster?
I don't because of how they did it. Because of what they were telling people to do. How people would lose jobs if they didn't get the COVID vaccine. How people, if you weren't wearing a mask, you couldn't enter into a restaurant. Some people had to eat with their mask on. It's just fucking bullshit. On
Bro,
top of
bro,
that,
bro,
the
bro, stop
mortality
being a
rate.
wuss, bro. You lived through a pandemic that's once in a lifetime thing, once in 100 years. Stop being a wuss. We already had 1.2 million people die, and it wasn't as hard as you're thinking. You're misremembering things that we were shut down like we never were. We were never fully shut down as a country. The mask mandates were just a suggestion. They were never required. You're just misremembering this stuff. You got to man up, bro. For
Wait,
real.
mass mandates were
You
never
you gotta
required to go
man
into
up, dude.
businesses?
Are you kidding me? There were people walking around with masks around their chin constantly. There were people like the restaurants were closed for like a couple weeks and then reopened with stuff outside. It was insane. People weren't actually locked into their rooms and locked into
Were
their
people
homes.
getting coerced to get the vaccine or lose their job?
Bro, if they were healthcare workers, yeah,
And other
because you
places too.
what?
and other places too
Where?
as well. Not
Where?
just healthcare.
Where?
You could look it up.
Where?
But I know it
Army?
wasn't
The
just
army?
healthcare.
You want the army? They're like, we're talking about like less than 1% of the population, bro. What are you talking about? You're misremembering this type of thing, and you gotta man up, dude. You gotta stop listening to Joe Rogan and these people that were so wussies about this shit. Yeah, come
No,
on,
I
man.
feel like I'm doing a good job listening to both sides because I do
No, there
agree
is
with you
no
on a
both
lot of
sides
things.
in this, man. There is no both sides.
There is both sides.
No, there
on this
isn't. No, there
because-
isn't, dude.
yes,
there
is.
isn't. No, again, dude. I'm telling you the truth. You gotta man up. It wasn't a big deal. You gotta just get your booster with your flu shot. It isn't that big of a deal. Just do the bare minimum for the people around you, and that's it.
I'm not. I wouldn't say I'm totally against the COVID vaccine. Like the person said in the chat, I'm against the politics of how they did it. That's what I'm against. 'Cause
Okay,
it was
then that's
weird.
gone now. All that, see, that this is the thing. Remember when all these people were like, "Oh man, these vaccine mandates are never gonna go away. Like we're never gonna be able to go anywhere without vaccine cards. Like, oh, they're gonna be forever. They're forever gonna take our freedoms away. We're never gonna have the mask off again. Oh, this is so bad." All of that nonsense was lies, bro. They lied to you. It was not that way. It's not that thing, and you got to just man up. They were wrong, and get over it, bro.
Okay, I have a question. You probably know more about this than me. I don't know about this, but do we know the long-term effects on mRNA vaccines compared to other vaccines yet, or no?
Well, dude, if you want a 20-year study, you're gonna have to wait 20 years. You know, like all
How
this.
long have they been out for? How long have they been out for?
What, 2021?
mRNA
Beginning of
vaccines.
2021?
Okay.
Okay.
So we don't know, right?
No, we absolutely do know, because we know the mechanism of action that a vaccine injury causes, and we know that do you know how many people died from vaccine injuries?
Not many.
How many?
You said
Say a number.
Uh,
6
I think
billion
you said-
dosages. 6 billion dosages of it. How many died?
500.
That's 100. It's like 120.
100.
1 in 50 million people died.
So-
and it was
so-
only the
so-
first dosage, and it was primarily the people in chat that you guys don't care about, the anti-vaxxers that just say, "Oh, the 1.2 million people don't really care if they died because they were all old people anyway." Well, guess what, guys? All the people that die from the vaccine injuries, they were all the average age was 66. So I'm sorry, but you guys are again, no young person is dying from a vaccine injury, bro. Yeah, everyone is saying that. That's what everyone is saying.
I do know. This is
Deal with it.
purely-
It is true. You guys are absolutely you're insane. Yeah,
this is
I love
purely
it. I love it.
anecdotal.
I love that you guys are so triggered in chat. It makes me so happy, genuinely. Vaccines are safe and effective. They do not kill people, and this is nonsense. People die every year from Tylenol, and people die every year from more water drinking too much water. It's just nonsense.
All right, so say for example, right? Hypothetically, this hasn't probably happened yet, but say if someone gets myocard, whatever it's called, right?
Myocarditis.
Yeah, myocard. Yeah, okay, I'm not even gonna say it because I can't even say it. So, say if they get that from the vaccine, not many people have, right?
Okay.
But say hypothetically, they have a heart attack or something, and say
That's
they
not what
don't know.
myocarditis is.
Oh, okay. I know.
Myocarditis. Okay, so I just someone was just spewing this BS in chat. So I actually have the Myocarditis Foundation, their exact words in this right now pulled up. So here we go. According to reports from 2022, myocarditis occurred in approximately 450 cases per million COVID-19 infections among males 12 to 17, compared to roughly 77 cases per million after receiving a second mRNA vaccine dose, with young males identified as the most effective group. So, chat, what's bigger, 450 or 77? And by the way, you actually, it's a factor of 5.8. So you are 5.8 more likely to develop, 5.8 times. So 580% more likely to have myocarditis from COVID-19 than you are from the actual vaccine, guys. This is the real. I'm reading text because I actually read primary literature and I actually look things up and I know what I'm talking about. That's why. Stay triggered, dude. I love these comments. Thank you, guys. Thanks for being here. Thanks for watching, and thanks for I love it. These anti-vaxxers, you could be anywhere in the world right now, but you're here with me right now, and I appreciate that. You guys are spamming chat. You guys are making the engagements go high. Thank you guys so much. I'm in the 99.9% percentile in comments and per live because of you guys.
Yeah, right.
Thank you so much. Thank you, guys.
Thank you, chat. Thank you. Appreciate it.
Keep it up, guys. I love it. Thank you.
Yeah.
So, do you understand what I just said? Do you understand what the Myocarditis Foundation said?
Yeah. Yeah. It's very.
So,
unlikely.
if you care about myocarditis, what's the right move?
Probably because you get myocarditis from actually getting COVID than
Exactly,
getting
bro.
the vaccine. That's what you're saying.
Exactly. 500% more likely. 500.
Yeah. How would you determine? How could you possibly determine that someone was unalived from complications with the vaccine?
It's
Like,
very rare, man. It's basically called ITTP.
Yeah.
It's a super rare event, man, and it's basically an immune response that happens, and it's super rare. I did the research right here. One second. One second.
And also, my next question is, how can if this ever does happen, right?
Yeah.
How can you determine if a drug or a vaccine or anything pretty much affects mortality rates?
So it's something. Maybe Michael can help me out in chat. It's like ITTP type immuno something. Immunothrombocytopenic purpura. It's an autoimmune disorder where the body's immune system mistakenly attacks and destroys the platelets, leading to a lowered platelet count. So it's like a super rare event, man. It's super 1 in 50 million. You realize that the COVID vaccine was the most administered vaccine of all time, 6 billion dosages. Like, it's insane. So they're not messed up with blood clots. And if you were worried about blood clots, you'd be worried about COVID-19 more. Again, just more nonsense, you guys. It's just so sad. It's pathetic.
What are the countries that you said 6 billion total people got the COVID vaccine?
Yeah.
What are the main countries other than the UK and US that didn't get it?
Well, that's a good question. I don't know. I mean, we did one of the worst in the entire world. We're ranked like 200. There he goes. Thank you, Michael. There he goes. We have a community of physicians and scientists here, and it's awesome. Thank you. There's not that many, basically. All the other all the other countries, that don't have adequate healthcare systems, all push their vaccines very hard because they knew that it was very beneficial for them to use it because they didn't have a thriving healthcare system. And what happened is they did a lot better than us. Deaths per capita, we're like ranked 200th in the world, bro. We did so poorly. We're actually it infuriates me actually that we somehow don't have any patriotism or care about the way that the United States actually should be leading the world in this technology, in this vaccine development. And we did good. We actually did good in having the science here, and we should be proud of our molecular biologists. We should be proud of our immunologists, but we don't. Because there's this anti-intellectualism, pseudoscience nonsense that's going through, and people got hurt because of it. So how is that? It's gross. There's no way that anyone is a patriot that isn't that isn't pro-vaccine. I'm sorry. You can't be a patriot and anti-vaccine. I'm sorry. You just can't be, because you're okay with your countrymen and your countrywomen dying that are preventable when they shouldn't be. And I'm sorry. You just can't.
Yeah. Yeah. I won't. I'm not going to disagree with you on that, because I do
Beautiful.
agree with the vaccines, because I get them every year. I'm not saying I don't,
Okay.
because I do.
So okay, can I just ask you a question then? Like, what
Yeah.
evidence would I need to present to you in order for you to think that the COVID vaccine is safe and effective?
Um. It's probably. Uh. I will. The reason why I'm not taking it is because the technology is so new, and I don't think it's been around long enough to
There's,
determine if it's entirely safe or not.
okay. Like, let's say, okay, bro, heaven forbid you get diagnosed with cancer right now. You go
Yeah.
into the doctor, they say, hey, you got a cancer, it's stage 2, it's right about to be stage 3, and we need to we have a new gene therapy thing that's just being delivered, that's just been created. And most of these gene therapies in the invention of CRISPR, a lot of them are just being rolled out, man, within the last 10 years. So it's actually
Yeah.
newer. So they started 10 years ago. The RNA vaccine started about in 1989, and then it took 25 years of molecular biology for it to get to the place that it is. But a lot of the CRISPR stuff is just getting rolled out, man. So, and guess what? They're using the same nanotechnology delivery system with lipid nanoparticles that we use in the vaccine. So, what would your argument be against us saving your life with a gene therapy that is the exact same technology as your vaccine?
Well, I would how I would answer that. It would go deeper than that, because if I have stage 3 cancer, my likelihood of death is
Stage 2.
probably higher.
It was stage 2.
Okay, stage 2. Yeah, I would probably get it because my likelihood of death is higher.
Okay.
And but I've gotten COVID a couple times, and I was good in 2-3 days, and it's just not
But that's
really.
not
I
the,
don't
you don't
I
know that,
personally
bro.
don't
You don't
think it's
know that. You
comparable.
like COVID, like we are seeing long COVID symptoms that are 10% of long COVID. The 10% of COVID cases develop long COVID, and we're talking about neurodegenerative issues where, dude, I have someone on last night whose son
Yeah, I
lose
heard.
like constant vertigo, constant
Yeah,
losing his smell, like losing his
yeah, it's fucked
hearing.
up.
You know, it's like
Hmm.
there's awful stuff. It's not like it's just some like, oh, we just, everyone, it's like the flu, man. It's not. And we're just learning about the mechanisms of what long COVID actually is. So and by the way, we do have about like 40,000 people last year died from COVID. So it's not like it's just, some random thing.
Yeah, but 50,000 people in 2015 died from the flu too. But also,
What? 50,000 people in 2015 died from the
or
flu?
2014 or something like that. 50.
2014 USA flu deaths. Okay. Yeah. 51,000. Yeah.
Yeah. So, but the thing is, I do agree. I really do agree that the COVID vaccine has helped, because if you look at the death rate, I don't think you could fake all those numbers.
Okay.
And
That's good.
um and if they did fake all those numbers, I don't think you could do it that massively.
Okay, that's
Um
good. At least.
so and if the death toll from 1.2 million dropped from 40 to 40,000, you can obviously tell that the vaccine did have some had positive effects in um in the world. So
It did. It did.
I'm not denying your
It saved
research. I'm not
2.5 million lives worldwide, dude.
Yeah. Yeah, I'm not denying your research. I'm not denying that, or the research that they have for COVID. I was just kind of wary about like the politics of COVID, and when was mRNA vaccines um first administered to the public? Was it recent, 2021? Because I heard people in the comments say it's been around for like 25 years. I did
So
not know
it's
that.
so the beginning of it is 1989. They're delivering RNA and protein and having that lipid nanoparticle deliver like a regular protein. But it had to basically, 25 years of molecular biology had to basically change. So how a gene is like is delivered for the expression. It's called like the expression cassette. So you have like the promoter region, which is where all the machinery lands, and then once it lands, then it goes through the it's called the ORF, the open reading frame, and that is what actually creates that protein. And then after it is the that's the terminator region. So the promoter and the terminator region are what's called untranslated regions. So they're not directly involved in the actual expression and creation of that protein, but they have a huge difference in the stability of that molecule. So basically, a lot of that 15 years was developing specifically the 3', which is the part after the terminator region, was developing it so that it actually protected the RNA piece from things called exonucleases. So things that come in and want to chew away that RNA piece. So you had to create this tail that was very protective and that allowed a lot of different copies of that spike protein to be made from that thing, so you could get good translation of that protein. So that's what took 15 years of molecular biology in order to have that done. And then at the same time, they're working on the lipid nanoparticle delivery, which is the thing that actually allows and coats it allows it to get into like the cell, because RNA is very unstable. So it's honestly very impressive that it can actually be delivered, that it can actually be expressed, that it can be stably made. It is amazing.
And would you say the mRNA vaccine from 1989 to now has evolved?
It wasn't an RNA vaccine. It wasn't an RNA vaccine in 1989. That was where the story starts. So that was just a protein that was being made, and it wasn't a vaccine. So that is what Robert Malone, where you kind of hear him like in the zeitgeist. He did deliver, like, it was like a GFP protein or like something that was really like, it was simple. It was a fluorescent reporter protein. And but it wasn't a vaccine. So a vaccine has its own problems and its own thing that you can't. But he grifts and he lies and he says that he is the inventor of the vaccine, but he wasn't. So that is where the story starts.
When was the next big breakthrough in that technology? Do you know?
That was BioNTech, and that was like it was in Germany, and that was basically there was this it was. But the breakthrough was the 3' UTR that I was talking about, the terminator region creating a different sequence to make sure that it actually is protected.
And is there any difference in the technology now, and any add-ons now? Like, I heard somebody say that, like, in the comments, I don't know if it's true, the nano thing, the nanobots or whatever.
There's no nanobots in it. There's those lipid nanoparticles. So lipid nanoparticle is just anything other than smaller than 100 nanometers. That's a nanoparticle.
Is that newer?
No, lipid nanoparticles have been around for a really long time. Nanotech. It's oddly enough, dude, I was actually in a nanotechnology lab. I used single-walled carbon nanotubes in my PhD research, so I'm actually kind of uniquely qualified.
What's that like? Is it pretty cool?
Yeah, dude, it's really cool. Yeah, hell yeah,
cool.
Dude. It's really cool.
What was the coolest thing that you've done in like research labs and stuff? I
mean, I pioneered basically using nanotechnology to deliver DNA into algae chloroplasts. So they had done it into land plants before, but I was really the first person to deliver DNA into algae chloroplasts with carbon nanotubes. That's where I was a pioneer in that field.
Oh, cool. Awesome. Well,
yeah,
so
nanoparticles are basically just anything that's lower than 100 nanometers. So that's anything. There's a lot of different types of different nanoparticles. There's a whole. It's not just us like fabricating them. That nanoparticles exist in nature, and nanotechnology is leveraging and using those nanoparticles for a specific purpose. So in this way, it's actually taking phospholipids, which are like kind of the thing that makes up the cell membrane, and then using them as a technology to coat the nucleotides, because the RNA isn't going to be able to just get into a cell. If you just put RNA in a thing, it's not like going to be it's not going to be there. But you can actually coat it with this lipid nanoparticle, and that it basically it's right in the center, and it acts like as a blob, and it goes up into the cell wall and cell membrane, and it can just get in that way.
Dang, that's cool.
Yeah, it is cool, man.
Yeah,
it is
man.
cool. We should be proud, bro. We should be proud of our scientists, man. This is the American exceptionalism, man. Like this is what you guys paid for with your money and your tax money. That why we are the premier elite, science and research institutions of the world. Like this is you should be proud of it. You should be patriotic about it. We should be
I'm sorry about
ahead.
cutting you off, but I keep saying everybody's saying I keep saying sorry, I have like a speech impediment.
You're good.
I have had it
You're
since
good.
I was 3rd grade.
You're fine,
But
bro. You're fine.
Have you ever talked to somebody that is an expert in this field, considered an expert in this field, that like on here that's come on that's like that disagrees with you at all, or is there been anybody that you've talked to, just anybody in the world, right, that is an expert in your field that disagrees with you at all?
Yeah, dude. We have not on here, but scientists,
Yeah.
man. Like we are ruthless to one another, man. They are so cutthroat. People think that I am like really like mean to these naturopaths that come on here, but I'm telling you, man, like an actual peer review process is actually insane, man. People quit their jobs because of how ruthless it is to try to get a paper published. It is so intense. And like you're at conferences and you're getting answered questions by world experts for an hour, and they're lambasting you about what type of controls you use, what was the experiment design, why did you use this approach, did you actually do the statistical significance right, why didn't you do this? Like it's relentless, bro, and that is just one paper, one thing, one conference, and it's ruthless at the lab level. Like when you're at the lab meeting every week, your professor is saying like, what are you doing? Why did you do this? Why didn't you do it this way? And then at the publication level, it's ruthless. And at the conference level, it's ruthless. Like the biggest thing that I wish people understood about science is that we are so skeptical about when anyone says anything, and we don't give people an inch, man. So the fact that things become reproducible, the fact that people can actually like set their hat on it and be like, hey, this is actually legit. That means that it's something, bro. That means that it really is something that people have actually done the work for to actually understand what's going on. Thank you. So we are ruthless to one another, but to come on here, I mean, not to toot out my own horn, bro, but there's not that many scientists that are actually on here. There's a lot of physicians, which is awesome, and there are like really good like panels and stuff. But the scientists coming on here and engaging the public and having like an open panel where people can come on and have one-on-one conversations, I don't think that there is many other places that are. I don't know of anyone else that's doing it.
Has there been any sort of evidence whatsoever that the COVID vaccine had any sort of negative impact at all?
Yeah, like I said, like the deaths, like it's like 1 in 50 million people.
Yeah.
But we're talking about like so many lives saved, dude. Like 2.5 million lives saved versus 100 people that died. I mean, come on. Like it's crazy. And we're talking about like 15 million life years. So we're not talking about people that were like, that were 80 years old with the life expectancy of like one more year. We're talking about like people that are legitimately like, have some life expectancy left.
Do you think there's a wrong age to get this vaccine?
No. I would get it at any age, every age, bro. Every age. Every vaccine is safe and effective, and it's way easier, especially when you're getting older. Even if you're immune compromised, a lot of times a physician will say that it's actually better to get the vaccine because if you're immune compromised, you can't actually risk an infection. And like, oh my gosh, you better get the vaccine. I had family members that were immune compromised with cancer, and they had like stage 3, stage 4 cancer, and they were like super immune compromised, and they're during COVID, and their physicians like, dude, you better get the vaccine, man. There's no way that you could survive a COVID infection. You need to get that vaccine. So the idea that like that the watch out, this thing could actually hurt you, it's like that just doesn't exist, man. That really doesn't. I'm sorry.
Was there other than the COVID vaccine? Was there any vaccines that had negative impacts after say 10, 15, 20 years on people?
No, there's
overall?
no mechanism that we would know.
Massive studies on that?
No, there's no mechanism of action. But because a vaccine, dude, is the RNA and the lipid nanoparticles. The RNA is going to be degraded very quickly, very quickly. Like the RNA is going to be chewed up and used by your cells very quickly. It's very.
That's why people get boosters, right? Because it goes away.
No, it's because your antibody levels go down after about 8 months. They start waning after 8 months, and then they go down really low at like about 11 months. So that's why the vaccine isn't staying in your system for that long. It stays for like, I think maybe like 2 weeks. But that's it. It's just you're getting the protein you made, and then your body creates a response to that protein that's made, and that's the antibody. That is the immune response that creates the vaccine immunity. And then it goes away. The RNA goes away. The lipid nanoparticle part goes away. So hey bro, it's been an hour and 6 minutes. So I just give you one more question. Okay,
that works, bro. Yeah, for sure.
So do you want to ask one more question?
That's good. No, I'm good, man. Good talking to you.
Okay. Hey, bro. Get any of your vaccines. I really hope you get the COVID vaccine. But if you get your flu vaccine, come in here and we will celebrate you still. Okay.
All right. Have a good one.
All right. Have a good one, man. All right. We're gonna go, Michael. I think you were first, man. By the way. So. Hey, Michael. How's it going, man?
What's going on, brother? That was actually good conversation,
Yeah, I think so too.
because you could see, young guy who's like hearing the facts and coming around. But what it just blows my mind that people don't believe that every vaccine, every single one, has before it's been approved, has been in a randomized trial,
Exactly.
human trial, every single one. Okay, just. And the whole purpose of doing them is so everything is reproducible. That's what people don't understand. If the study isn't reproducible, so when they're talking about funding from Pfizer, from whatever, or cancer drugs or whatever, yes, people don't understand exactly what you said. Somebody's got to pay for it, but the FDA is not going to approve it.
Exactly.
If it's not.
Exactly.
And you see how much stuff they reject. They reject more than they approve. And it's brutal. Just take some of the drugs for multiple myeloma recently. Like I saw the studies because I had stock in one of the companies, and I was like, oh my God, great study. The FDA did not approve the drug until another study was done to confirm that study, even though it was positive. So, they're brutal. I'm on the editorial board of the Journal of Clinical Lipidology, and I'm a jackass when I get a paper to review that's totally irrelevant. And the data's bad. So, we're allowed to have intellectual discourse, and people think that you and I are paid.
Yeah.
And so now, healthcare providers, you said, I was like one of the first ones to get the vaccine. I don't know anybody who wasn't on the front lines who was like praying to get the vaccine because we had friends die.
Dude, I drove 3 hours in order to get it.
I mean, I remember waiting in line at like in South Central LA to get it, and it was administered by the fire department, and couldn't wait to get it. Now, in retrospect, because there's been passive immunity, herd immunity developed, and enough people have it.
Yeah.
The only recommendation is, I'm not even saying that's a recommendation, but if you ask males 15 to 25 who are healthy, probably don't need to be vaccinated. That's the only subgroup of people who the American College of Pediatrics is saying, and it's because immunity is developed. Okay, but that wasn't the case. That's now.
Yeah.
Because I just did a podcast with a pediatrician, a really well-known pediatrician, and I asked her, I said, what subgroup are you guys now recommending? And she said, that's the only subgroup who we're saying they don't necessarily need it.
Are they doing the study for the blood titers though, to know that there's actual like antibodies?
Yeah.
Oh,
absolutely. But
interesting.
the other thing is, as a cardiac surgeon, that I can tell is myocarditis in the majority of the people is not a big deal.
Yeah, could you talk about that? Why?
Yeah.
Like why is
myocarditis is if you look at it, I want to say it was 0.3 to 0.5% per 100,000 people who maybe got myocarditis, and they were diagnosed by enzymes, not clinically. Okay, so people weren't sick. Like the majority of people who get myocarditis are not dying. We're not transplanting them. It's the rare patient who gets transplanted for myocarditis. And and like you said, COVID, just like you saw that thing I wrote where we have found that COVID lives in atherosclerotic plaques.
Mm-hmm.
So not everybody dies from respiratory failure, contrary to what people think. The majority of people die from rupture of plaque. Okay, and the heart attack is one of the main causes of death in COVID. So COVID is the most potent inflammatory. It's not the vaccine, and that's where all these guys don't understand, and they're getting misinformation. The French guy who was espousing hydroxychloroquine, that doctor.
Oh my God, yeah.
That nut
Back
job.
in the day, that's the OG ivermectin, man. That's
right, but he didn't even publish in a journal. It was his own. And people buy that shit hook, line, and sinker.
Dude, what really pisses me off is that when they just upload it to the preprint server, and because there's a DOI number, people think that it's an actual study. It's like, oh my God.
Exactly. And he was like, 300 consecutive patients. And I always tell people, even when you do it, back prior to electronic medical records, when you're a resident studying, and it's like, they're like, you need to have a publication, in order to get into your residency, or you're in your residency, so you do some bullshit retrospective study, and you're pulling the charts, and it's like, okay, 100 consecutive patients, and you want to see this. You think they're really consecutive? No, and that's why all these studies are bullshit. If the chart's thick, you just toss it to the side. Okay, those were the days. So unless it's a randomized study, retrospective and observational studies mean nothing. They're anecdotes.
Yeah, exactly, man. It's really frustrating. The myocarditis thing is so wild to me.
19 or 20 years, with the cancer vaccine. And I wrote on my Substack a paper, would you get an mRNA vaccine for cancer?
Yeah.
And the people who I know who are anti-vax, they're like, hell yeah, it's cancer.
Exactly.
And I'm like, dude, it's the same exact technology. You'll get it for cancer. Well, cancer is a fatal disease if you let it go. And I'm like, so was COVID. Everybody was dying. I mean, I think, what do you think, right? Like, I think probably the messaging was wrong initially. In other words, people believed that the COVID vaccine was going to keep you from getting COVID. Yeah. And that was the message that was wrong. I mean, do you agree with that? Rather than saying...
Yeah, I mean, so any type of vaccine isn't going to prevent a viral particle from landing on you and landing on your nose and proliferating, right? But what it is going to do is that it's going to decrease your viral load, right? So even if it is SARS-CoV-2, and this is why it's so frustrating to me how everything is colloquially COVID-19 from the pandemic, and this is why we have to be so specific about talking about SARS-CoV-2 infections and COVID-19, that you can have SARS-CoV-2 and have a decreased viral load in SARS-CoV-2. And yes, if you have a decreased viral load from a vaccine, then yes, you are going to spread less viral particles, so you are going to decrease the spread of the virus. Like that is absolutely true. But is it going to prevent you entirely from having COVID-19? No. Like, because there could be, you could get so much viral particles from somebody that it puts you over that limit where your body can't deal, your antibodies can't deal with it. So then it starts to actually accumulate to the point where you have COVID-19. And it's very simple, guys. You have to think about it in that way. You have to separate SARS-CoV-2, the virus, versus COVID-19, the thing that actually, the disease that is caused by the virus. It's just like HIV and AIDS, guys. You know this intuitively with HIV and AIDS, right? Everyone that gets HIV doesn't develop into AIDS.
Right, exactly. So I think the message, somebody just wrote, turbo cancer is increased because of the vaccine. So I did a short on that. The only people believe that there's some disease called turbo cancer are anti-vaxxers. There's no type of cancer called turbo cancer.
Yeah.
You know, I mean, it's insane. And, you know,
And ivermectin, again, so we mentioned ivermectin and people started screaming in the chat. So again, here's a systematic review and meta-analysis of ivermectin for the treatment of COVID-19. Evidence beyond the hype. This is Marculano 2022. Marculano 2022. Conclusions. The evidence suggests that ivermectin does not reduce mortality risk and the risk of mechanical ventilation requirement.
Correct.
Although we did not observe an increase in the risk of adverse side effects, the evidence is very uncertain regarding this endpoint. So again, guys, ivermectin does not reduce the mortality risk.
It doesn't work even a little bit.
It's crazy.
And the same thing with you know, I wrote an article on fenbendazole for cancer, you know, because everybody now thinks ivermectin and fenbendazole for cancer, you know, which is another ailment. None of them worked for COVID. None of them. But you know what did work? There's two randomized trials. Statins decreased mortality.
Oh, interesting.
People who were going into the ICU, if they were on a statin or placed on a statin versus no statin, cardiovascular mortality was reduced. That was shown in randomized controlled trial.
Interesting.
The data, you know. So, you know, I mean, I don't know. I don't know. I mean,
Carrie, it did not reduce mortality. No, that is exactly what we're talking about. The mortality risk is exactly what that is. I'm sorry. That is, I mean, again, like, you guys, people are lied to you, and you come in here and you try. It's like, it's wild how many of you guys just parrot the same things that people tell you, you know, and it's so sad, guys. It is so sad because people have died at 10 times the rate. Unvaccinated people died at 10 times the rate, and I am asking. It's mostly Republicans. I'm telling mostly Republicans to care about your own communities that were dying at 10 times the rate, and people don't. It's actually so sad that you guys don't even care about your own people, man. Like it's wild to me. So it is very, very, very sad.
Well, it's the same thing with masks. It's no different. You know, my ex-girlfriend died last year of stage 4 lung cancer, for example. Okay, when she was neutropenic, her friends who were hardcore anti-vaxxers, you had to wear a mask when you came in the room, and they were like, "Nope, I'm not gonna. You know, it's my autonomy." And I'm like, "You're not doing it for yourself. You're doing it for her. What the fuck don't you get?"
Exactly.
And I'm like, "Put on a damn mask." And you know, if they wanted to see her, that was real. So it's like you were wearing a mask to protect other people.
It's frustrating, man. The medical people that push that stuff. It's just it really infuriates me because people don't understand. They see the MD or they see the PhD and they these grifters that like had a failed career and they were on a bad track and they saw it as their chance to get in. You know, like there was that whole physicians group that was going around the country saying that like you didn't have to worry about this and it was all nonsense. It's like there's a lot of them lost their licenses, which is very good. Which is very good. It's
So
it's unbelievable.
you know what I was doing during COVID, and and this is just because of the transplant literature, and you can Google it. So potassium iodide is a potent antiviral, and that's from the head of transplant, solid organ transplant at USC. So they've played around with it for years. So a couple transplant surgeons, you can actually buy it off of Amazon, potassium iodide, 0.5%. We're just swabbing our nose. And a couple of the guys, I didn't get COVID till way later, till I stopped using it, but nobody got COVID. Nobody. And, but that's in the transplant literature. And we were like, don't tell anybody because they're going to sell out. It's a limited supply on Amazon.
Interesting.
But I have a bottle right here. And, but there's science from the transplant literature being antiviral.
Yeah. Well, thank you, Mike, for being in the trenches with me, bro. Thank you for being on here.
No, I really like that kid who was talking because you could tell he was confused, but he was willing to listen and willing to learn.
Yeah, guys, Michael has really good information. He's a physician here trying to do science communication, so you should give him a follow. And I appreciate what you do, man. You're always really good, and I love your presentations and everything. And it's thank you for being here, dude.
Thank you, man. No, I appreciate it. I love your stuff.
Thanks, man. I appreciate you.
All right, man.
All right, talk to you soon, okay?
All right, yeah. Golden Retriever's got to go out and pee. So
nice. All right, have a good one, brother.
All right, brother.
All right. Okay, guys. I don't know what order it is, guys. And Leonard, you're gonna go last, bro. I'm sorry because you talked over an hour, and I'm down to talk again. So everyone, if you guys wanted to queue again, it's okay. We're just gonna do the 5-minute timer and kind of go through people. Okay. I just want to give everyone a chance. Okay. Thanks, man. All right, Faith Marie, how's it going?
Hello, can you hear me?
Hi, how's it going?
Good. I just want to say that I have a son who has half a heart, tricuspid atresia. He has like 4 or 5 different heart defects. I personally believe the pharmaceuticals cause his heart defect, but I also believe in the vaccine. So I'm in a funny predicament, and I work in health insurance for 25 years. So I see what health insurance companies do. And I also struggle with MAHA in general. I know it's a personal lifestyle, right? To make sure we're eating healthy. But I always get hooked into the right pipeline, and I always have to back out of it just because I know RFK is not a good guy.
True.
And I know what he's doing is to hook into people's mental health in a bad way. So I struggle, but I am 100% as far, planet Earth as possible. And I don't believe in pharmaceutical drugs in general, but I do believe in vaccines, if that makes sense. If that makes sense.
They're super effective. It's hard to say you're not. It's hard to be against them, to be honest with you.
Oh, no. Actually, we, during COVID, my son's 16. He's getting his license right now. And he'll need a heart transplant eventually. We don't really know when. He has tricuspid atresia.
Okay.
With transposition of the great arteries, and he has a couple others in there also. So his heart's not normal, right? So it's like instead of a figure 8 circuit system, it's just a circular. The blood just drops right back into the lungs and gets pumped back out through the heart and bypasses the heart completely. But during COVID, we 100% he was 100% isolated. No outside communication at all, besides one person. His dad and I both sat down and kind of talked about it because of the risks. And we knew we needed to protect him. No matter what. It didn't matter, right? So we got vaccinated. We made sure he got vaccinated. We made sure everybody else in our household got vaccinated. About a year later, my other son was diagnosed with EOE, which is another, I can't even say it's autoimmune, but with EOE, which is the best way to describe it is asthma of the esophagus. That's the best way to describe it. If I were to talk to a GI doctor, that's how they describe it. But he had it since birth, undiagnosed for 15 years. And I can say for both of my sons, being vaccinated is probably the safest thing.
Nice.
Just because of the risks. The risks of if they were to get COVID or even the flu.
Yeah.
We're at higher risk even with the flu. But I guess, okay, so my big thing is with COVID and the flu. So the flu vaccine has been around for ages, right?
Yeah.
I kind of correlate the flu vaccine and the COVID vaccine in a similar grouping, right? So there's a lot of people that don't get vaccinated for the flu. But they always recommend it for the elderly and the young. How do you look at the COVID vaccine and the flu vaccine differently? Or do you look at them in the same category? Do you think it's okay for like young adults?
Yeah, just get both of them. Get both of them every year. I don't think that there's like, you're young, you're healthy, there's no reason to get it. And the risk of long COVID, honestly, I wouldn't risk it. You know, there's people, the long COVID, it does exist. It does happen. It's a neurodegenerative disorder that we don't really understand yet. So I don't think it's worth the risk personally, especially when a vaccine could help you with that. So.
Oh, yeah. So I agree. I agree long COVID is a thing. But I guess I'm wondering the mentality. Like, so when I was in my 20s, before I had kids, I never even thought about getting the flu vaccine.
Yeah.
Do you know what I mean? Not until I had a son with half a heart was I like, oh my gosh, I need to get, that was the first time I got vaccinated when I was pregnant and found out I was going to have a child with half a heart.
My mom's a nurse, so I've gotten flu vaccines every year because she would get a flu vaccine, and I got all the COVID boosters. I got a booster on my immune. When I went to grad school, I didn't have my immune card. My mom lost it, so I got all my immune shots again. And then when my wife was pregnant, I got more Tdap and MMR boosters, and then I got all my COVID boosters. I've taken every single vaccine that I could possibly take at every single chance in my entire life. So,
because your mom was a nurse, right? Because your mom was educating you.
Yeah.
But a lot of us, like, I didn't even realize until my son. Like, I didn't even realize I was living in my 20s, didn't even think about getting my flu vaccine.
Yeah.
Didn't even think about, even though they would ask you when you go to the doctors, do you want to get your flu vaccine? I'll be like, oh, no, not this year. The first time I got vaccinated was the year I was pregnant with my son. When I found out he was going to be having half heart. And then when he was born, we were at Children's Hospital. The swine flu happened, and they had restrictions, right? They didn't have any vaccines for that. I guess the biggest thing is, so I even tell my friends, like, I'm sorry, I'm not going to hang out with you and go out with you unless if you're vaccinated, because I don't want to bring it home to my son.
Yeah, especially with your son. Yeah.
Right. And it's like, you're not even thinking, and I think you said this earlier, people aren't thinking about the people that they're putting at risk.
Exactly.
And that's what bothers me the most, is that we're in a community of other people.
Exactly. And I think just like how civics, the baseline civics expectation should be you vote, like the baseline civic public health thing that you're out in public is that you're vaccinated. I feel like that they go hand in hand, and we live in a society, guys. We live in a civilization, and it's just everyone should be vaccinated. There really isn't any I don't think that there should be any exceptions. Yeah, washing your hands is another one, of course. So, but there's you're out in public, you should be vaccinated. There's no excuse, guys. You're healthy, you should be vaccinated. I don't think there should be religious exemptions or anything like that. There's just, you're out in public. It doesn't matter. So
Right,
it's
you're
not a
putting other
personal
people.
choice. No, it's not.
Right, you're putting other people at risk.
Yeah.
And then with this whole mega stuff, they're pushing this agenda to like get people to think it's not cool.
Yeah.
And we are currently in my state having a measles outbreak.
Exactly.
Which is,
so make sure you get them up. So thank you,
Yes,
Faith,
yes.
for coming on. I really
no.
appreciate you. What was that?
no, you're welcome. No,
Okay.
you're welcome. I was just saying you're welcome.
Okay, thank you so much for popping in, Faith. I think that was such a really good story about your family members and looking out for your kiddo and being you're a good mom looking out for him. So, thank you for popping on. All right, Gen X 1979. Sorry guys, I don't know what order you guys were in. I was in that conversation when you guys all piled in. So, we're just doing 5-minute timers. I'm gonna get to everyone. Don't worry about it. Gen X 1979. How's it going?
It's going great. Thank you so much for letting me join in because I have a very different view, but I loved hearing what Faith had to say about her personal experience. At the beginning of all of this, I've never been anti-pharma ever. I've never been anti-vax. I've had every vaccination can imagine. At 9 weeks old, I had spinal meningitis. I was a very sick baby. But I've had a DVT due to some medication to help me with polycystic ovary syndrome. I didn't know I had it. It was at the height of the prime of my youth and health. So I've never really had major issues, but I have had some things that were unexpected that could have been fatal because I just don't pay attention. And when all this happened, I'm a public school teacher, elementary. I'm not a doctor. I'm not a physician. I don't claim to be. I'm okay with being wrong. I really, truly am. But I'm very curious. I'm just very curious. And because I had a DVT in my calf at the height of my health as an adult, due to a medication that was kind of like a newer medication, I was afraid of it. My parents are very conservative. I'm from Alabama, you can probably tell. And they were very, they were afraid that my dad was like, I hope you don't die. I hope this doesn't cause, and I was like, I hope so too, But it was very isolating. I had a hard time with some things that became so politically divisive. And I had a hard time understanding why it was being pushed and why it was free when we have so many type 1 diabetics that can't get medication. There are some things that just in my head I just really struggled with. And my own personal doctor was very hostile is not the right word, but he was very upset with me that I chose not to do this. And I did get COVID. It is a sickness. My dad went to the hospital with it twice. I do believe in it. I did believe in it. I gave plasma afterwards. I had antibodies. They wanted me to come back because I was not vaccinated, and you probably know so much more about that than me. I just had a very isolating experience. I taught every day with people that we were told to wear masks, but they were on everybody's chin all the time. And it just didn't, I was like, what? I'm not really smart, but what's going on? And so, I don't know. There was too much contrast in what people would say, and it was a daily thing. And then I don't know that everybody was getting the same news. That probably everybody now would agree with that. But I think different people in different regions of the country and maybe the world were just getting different news through their algorithms and information. And that caused a lot of people to be upset with each other and more isolation. And I don't know. I don't know what it was. I know it was a sickness. I don't. I make connections sometimes where maybe there are none, but I'm extremely ADHD, so that tells you a little bit. But I started looking into radiation poisoning, and the symptoms are it's interesting. Is probably all I'll say. But I did go through my ugly phase where I would just get mad and frustrated. But then I finally got to a point where I was like, you know what? I'm going to do what's best for me. But I know that there are other people who have different opinions and different reasons. And I really am glad that I came to that conclusion. But I still don't know that it's for me. But I'm not anti-pharma at all. So for what it's worth, you know.
Yeah, I mean, so your physician. I'm sorry. I just your physician said that it was okay for you to get.
He was upset that I didn't.
Yeah.
That I chose not. Yes.
I mean, I think that you should just listen to your physician then and just get it because he's gonna know your stuff the best. You know. So.
Well, usually I do. I mean, very smart
Yeah.
man, very good man,
Yeah.
and
Then-
saved my life and my dad's.
Yeah. Then
multiple-
do that. Then just listen to him. Just listen to him.
Well, but
But
I had.
you wouldn't second guess them for heart surgery or brain surgery or anything else.
Well, but
So-
I'm my own. I will say this, and I know the time has run out. I work in education, and we have so many individual education plans. And you know, the human body is so intricate, but we're all so different.
But he knows you the
And-
best. But he knows your file. He
know-
knows your background. He knows it.
I know me the best. I feel
No.
though.
No, you don't.
I didn't
No,
mean
you
for
don't.
that to sound ugly.
You don't have
but,
the expertise. No, you don't.
But I did know that I wasn't aware that a certain medication I was taking gave me a DVT. I was running 5Ks on them. I was on my 18th 5K. Thought I was going to have a heart attack, and it was a DVT in my leg due to a medication that most people don't have a problem with. And so I think that fear, because I didn't know and I live alone, like I think that fear caused me to go, I can always go get it. I can always get it. And then once I had COVID and the antibodies, I kind of held off a little while. I know I don't know everything. Like
Yeah.
I know I don't probably know most things, but
That's good.
it just wasn't for me at the time. If it ever comes time for me to do that, I'm open to that and I'm open to being wrong.
Yeah.
But for me, it just was scary.
Do it for. I understand, and these people lied to you, and they said that it was a risky vaccine, and that these people were being injured, and they're not. They just weren't. It's like one of the healthiest vaccines that was ever produced. 6 billion shots. 1 in 50 million vaccine deaths, and that was for only with 6 people that were like 70 years old. So the idea
Yeah.
that there's injuries going around and all these things, it's just there's lying. People are lying
I
to you.
think it was the rush. I think it was the
It's
rush.
not. There was
that
no.
made
They
me-
weren't rushed. No, this is another lie that people told you. This is
Well,
not.
no,
It wasn't
no.
rushed.
My experience was it was a rush. Like there was a rush to get it. I mean, and,
No, it's
and I
because we were in
felt
the middle of the pandemic. It wasn't. There was. I mean, people's lives were at the stake. So it's.
How
it's
How did you feel about what the gentleman said about potassium iodide? I did get 2 bottles of that actually. I never took it, but
as soon as the vaccine was available, he got that instead.
okay. So well, I had it. So I had it in 2020, December of 2020, before the vaccine came out. And I will say I did keep a close watch on my antibodies. I did, and the people at the plasma place kept wanting me to come back.
How
So
would
as long as those
you were
were
getting a
there-
serology test for your SARS-CoV-2 antibodies?
I mean, I don't know what they were doing, but I did give plasma, and they would not take it from anyone who had taken the vaccine. I don't know what that was about, but I guess they were studying it. I'm not sure, but I was like, I don't care, whatever. I just was hesitant. I mean, I'll probably die of yellow number 5 from the soda. Okay, so like I'm not a health nut by any means. Something just didn't feel right about this. I don't know what it was.
And everything was right. It was that you were lied to.
That's probably true.
That's the frustration part, where these people that are pushing this disinformation are getting to people like you that would have been no brainer and just gotten the thing and it would have been okay. But now, because of this, like teaching the controversy kind of nonsense, because science and medical doctors, we coddled these disinformation pushers for too long and we didn't engage with them and call them out and say that these people are lying to you. You know, that now we're here where we're actually having people, and we had these people die, in our country that were died because, it's
I
just
definitely
awful.
agree. People die, and it was a bad sickness. One more question I have for you is what was the gain for those who were pushing the misinformation, for there to be so much, like money had to be somewhere in all of this,
Because they basically, Robert Malone is a good example of this. This is the guy, 1989. He's a grad student and does this delivery of a protein, not a vaccine, not even remotely close to a vaccine, and then 25 years of molecular biology has to go by in order for it to become a vaccine. And then guess what? He comes in at the very end. He's failed as an academic. He's failed in the private side. He doesn't have any good scientific career. But guess what? He comes in at the end, says that I'm actually the inventor of the mRNA vaccine, guys, and I can tell you that it's not safe. So, and guess what? What happens? He goes on to Joe Rogan. He goes on to all these podcasts as the inventor of the mRNA vaccine. And guess what? Now he has a huge career. He's worldwide famous. He's on the HHS boards. He's been able to completely reinvent himself as a failed scientist, as a failed academic, as a failed everything. But now, because he grifted, he lied in order to make money and make a profit and reinvent himself. He was successful, right? He is successful because of it, and we have to clean up the mess because of that.
For what it's worth, and some of the comments I know are ugly about me being from Alabama, whatever. I'm in the center, so like, if anybody wants to like go there with me, like it's really not like that even in Alabama, I promise. But I just really had a lot of questions, and some things didn't add up to me. But
It's okay.
I appreciate.
It's okay. This place is exactly for you. The comments are its own thing. There's a lot of different people. Like we need people like you to hopefully, like, this place is for you and people like you to ask questions and get your answer that you've been wanting for years and never had a scientist friend in order to do it. But I'm your scientist friend, and I'm here to tell you that unfortunately these people lied to you, and it's safe and effective, and you can take it.
Yeah, it definitely stirred up some confusion. Thank you so much for your time. I really appreciate you, and thanks for being so kind.
Yeah, no problem. Have a good one.
Yeah. All right.
All right. Debate Doc. Debate Doc, how's it going, man? Come back to us. Hey, there you are. How's it going?
Doing okay. I just had a couple cool questions for you.
Okay.
If that's all right.
Sure.
Sorry, my Wi-Fi went out, so I apologize. My connection's a little choppy.
You're good.
So I'm a relatively new grad. Well, not relatively. I'm a very new grad MD. Graduated in May, so it's been a whole, 3 months now. And I've been, kind of dabbling in some of these kind of TikTok live debate spaces.
Nice, man.
Trying to, to the best of my ability, correct some of the misinformation, like health-related misinformation that exists on this app, because there's a lot of it.
It's bad. It's bad.
It's pretty rough. It's pretty rough. I haven't run across you yet, so I'm very glad that I kind of stumbled upon.
Yeah, dude.
Stumbled upon you tonight. And I really like that you had that cardiothoracic surgeon up. That was really cool.
Yeah, dude. Our community is
about COVID and atherosclerotic plaques.
Yeah, dude. Our community has a ton of like physicians and scientists in it, so it's like it's pretty cool. The people, if I don't know something, there's like an expert sometimes in the chat that we can just pull them up, and we've had like really, really awesome conversations where people have gotten like advocated for themselves to get into clinical trials and kind of like talking about oncology and all that kind of stuff, all the way to obviously like most of the questions are about COVID though, because that's kind of like the biggest thing that's happened in a lot of people's lives. So everyone has questions about it,
Yeah, that makes sense. But yeah, no, I mean, I had no idea about the kind of relationship between COVID and atherosclerotic plaques, and like the kind of mortality benefit of statins. So that was all a cool learning experience for me. So one comment, one question. The comment, I think, kind of to piggyback off of your explanation of why people might have lied about COVID. I think that was a great example of the guy who contributed to like the sort of invention of the mRNA vaccine. I think a big part of it is also just like politics. I think that they saw it as a convenient kind of political culture war wedge issue, and they were like, if we can weaponize fear of this thing and make it a kind of powerful driving force in these people's lives, then we can capture them as a voter base. So I think that was a huge part of it.
For sure.
But my question was,
but just by the way, it's really interesting. The vaccine rates though for older Republicans, totally normal, in the high 80s, like where they should be. It's only younger Republicans, younger than 50 and below, that actually have like vaccine hesitancy. So it's just it's very weird. But yeah, go ahead.
I guess for older folks, their fear of unaliving outweighed their
yeah, dude, they've been around for polio. They've like understand that. Yeah.
So my question was actually had to do with the vaccine. So I heard the cardiothoracic surgeon mention that the one group that may not really need it, given the amount of kind of herd immunity that's developed, is males ages like, I think he said 15 to 24, something like that.
Yeah.
These kind of like young adult males, or like late adolescence, young adult males. And I guess, my question has less to do with the science, because I'm sure the science is there, and I'm sure the science is good. Has more to do with like the messaging, because having been in some of these spaces, I've seen how strong the kind of anti-vax sentiment is, and how desperate these people are to kind of cling on to any bit of quote unquote evidence that they can find that justifies their kind of anti-vax preconceptions. And so there's a part of me that thinks like, even if the science is there to say, hey, like they might not need it, like it won't hurt them, but they might not need it. If even putting that out there is a good idea, because if you put it out there that there is any population of people who might not need the vaccine, I feel like that's just a convenient target for all these anti-vax people to glom onto and be like, hey, look, there is a group that doesn't need it. This is evidence that the COVID vaccine is unnecessary.
Exactly.
Et cetera, et cetera. So I just kind of wanted to get your thought on that.
Yeah, I would agree for everyone to get it, because you're getting, it's in the middle of a pandemic and you're having the sequence being updated every year. So you would just you get, if it is divergent, then you're getting broader antibody immunity to it. So it would be better in my opinion. But I think it's we're still in a pandemic, guys. We're still in a pandemic. The sequence is still changing. That's just like HIV is still in a pandemic, technically. So I think that the benefits outweigh it, and especially with long COVID, I would want as high of antibody titer as I possibly could, right? So that I don't have to worry about the developing long COVID, which is a neurodegenerative disease that we don't really fully understand.
Are you still actively involved in? I don't really know much about your background. Are you still actively involved in research? Or are you more on the kind of like scientific communication side now?
Yeah, I mean, I got my PhD in 2023 in microbiology, and then I was working in the private side, and then I was the victim of the Trump science spending freeze, and our site got laid off. So that was like 2 weeks ago. So I'm kind of doing this thing right now, trying to trying to move actually into kind of like patent law. So trying to become a patent agent and help with people doing the registering patents and stuff. But I did bench work for 16 years. So I'm basically mainly a molecular biologist, but I've done next generation sequencing. I've done yeast host generation. So I changed genomes of yeasts, of plants, of algae chloroplasts. And then I used nanotechnology to deliver some molecular biology tools in my PhD.
That's really, really cool. That's
Thanks,
awesome.
man.
Thank you for sharing that.
Cool. Yeah, no problem.
There's a part of me that kind of wants to get a PhD, maybe, but I feel like I'm a little long in the tooth for it now. It'd have to be something that I would like try to do during residency, maybe.
Yeah.
But I don't know.
Dude, there's so many cool like gene therapy
it just seems
like
cool to
stuff.
have, like,
I mean, it's unbelievable. David R. Liu, that's like my favorite molecular biologist right now. Like he's doing some incredible things with like gene therapy. He did use directed evolution to create that Cas9 that just does single nucleotide changes. It doesn't do the cuts, so you can actually change single nucleotide diseases. Wow. So it's incredible. David R. Liu, he's on Twitter still, and he's one of the steadfast Twitter science guys. But he's an incredible follow.
So, okay, I know my time's running out. Final question for you. So I'm actually in orthopedics, not so much, the kind of like internal medicine side of things. But like, I mean, like, so just kind of out of curiosity, like, do you know of any sort of area of orthopedics in which this stuff, is kind of being utilized? I mean, I feel like ortho-onc would be, the, kind of most sort of reasonable one to me. I'm just kind of curious if you have any.
Man, no, not really.
Insight into that.
Yeah, I guess I'm just molecular biology and kind of like, I'm actually curious about, I don't know. I'm gonna have to look into that. Like I wonder what gene therapies are doing for orthopedics. It's a really interesting question. I'll have to research that. I'll look into that. I
feel
tonight.
Like it's either ortho-onc or there's oh, awesome, thank you. There's kind of it's still very new, but there are quite a few people who are looking into kind of cartilage regeneration or cartilage like growth, chondrogenesis stuff.
Oh, okay, that'd be sick. Yeah.
So I'm wondering if that could be a target.
Yeah.
So.
Yeah, dude,
that could be cool. I mean, I think if they could pull it off, that would be pretty revolutionary.
Yeah.
I don't think they were doing anything with like kind of on like the sort of genetic side of it. I know a lot, but a lot of it is kind of cell bio, like trying to make these. They're trying to create like chondroplasts and create these like kind of. I wish I remembered more about it, but yeah, like autologous chondroplast stuff, and they create these like. Little like kind of matrix things that they like inject all of these like autologous chondroplasts into, and then they try and create these like little kind of clonal sort of chondroplast populations within this sort of like matrix thing that they can then like reimplant as a kind of a sheet of cartilage.
Yeah, that'd be sweet.
I explained that very poorly, but hopefully you kind of got the idea.
yeah. I'll have to look more into it. That's really cool.
Yeah.
Yeah.
Anyway,
sweet.
Thank you so much for your time, and
Dude, thanks, man.
I've definitely learned a few cool talking points for some of this COVID stuff. So I really appreciate it. Thank you.
Yeah, bro, I followed you. So I'd love to link up with you in the future, and we'll have to talk more. Okay.
Yeah, that'd be awesome. Thanks, man. Have a good night.
Yeah. All right, nice. Have a good one, man. Awesome, guys. It's always good to see more science communication going on, isn't it? I love it. It's so awesome. Corey. I know, Christy. I totally agree. Hey, Corey. How's it going, man? What's up?
Dr. Greg, how are you?
Oh, dude, I am so sorry. I forgot to review the thing that you sent me, dude. I am so sorry.
No worries. How you doing?
Good, dude. Good.
No, I appreciate you having me on tonight. So I
Yeah.
have a question.
Okay.
So I'm in nursing school, and I had to get all my shot records
Mm-hmm.
sent over to the nursing school, and I had to get the MMR titer done. I
Mm-hmm.
didn't know where my shot records, and it came back that I didn't have the antibodies. Is that like common for MMR? I had them when I was a kid. I
Yeah,
had
it
to.
goes away after man. It goes away. It's not forever. You know.
Okay.
Yeah. Yeah. It's they recommend it like what every like 20 years I think. So yeah, man. Yeah, it's always good to rehash them if you can, and you know, yeah, that's why the immunity card is like a good thing to have. But if it's so long that you don't even have it, it's a good. There's probably a good thing to maybe just get it anyway, just to make sure you're all measles, mumps, or rubella.
Okay. Because I
Yeah,
did get one booster a couple of weeks ago. So is it recommended to get the second dose? Like, I think it's like a month later.
that's I don't know. That's a good question. It's a good thing to ask them. I don't know,
Okay.
but yeah, that would get the entire series if you need to, for sure.
Okay. And then the last question with the whole thing about COVID. Is it good to get COVID and the flu at the same time?
Yeah, you can.
Vaccines? Okay.
Yep,
I
no problem.
just,
It's just good idea to just get both of them, get done with it.
yeah, perfect.
Yep.
Well, thank you. I appreciate
Yeah.
you.
Oh,
I love the
Corey,
show.
and when you get your vaccines, dude, come in here and we're gonna celebrate you and throw you a vaccine party. Okay?
I'm going tomorrow, so I
Nice,
will be back tomorrow night.
dude. That'd be awesome. Let's go, Corey. Let's go, dude. All
Thank
right.
you.
Awesome,
Have a good
man.
night.
I have a good night, Corey. I'll read your thing tonight after stream and talk to you about it tomorrow. Okay?
Okay.
All right.
Take
See ya.
care. Bye bye.
Friend of the stream. Corey's a legend, guys. Just helping his local community and making things better for the people around him. That's Corey's an awesome guy. Butterfly grounded. I accepted. We're seeing if she can join. Yeah, exactly, Linda. Yeah, especially with everything, the increases of measles cases, you definitely want to get your MMRs, guys. Definitely want to get your MMRs. Oh, okay. I accepted and she didn't join. Okay. All right, guys. Before we go, Leonard has another one, but we have to go do our thing. Guys, we got a science segment and we got so you guys want to do science? I didn't want to be live. Oh, okay. All right, Butterfly, no problem. Sorry, you requested, so it's all good. It's all good. All right, guys. You guys want to do the science segment? It's actually a pretty cool one. Let's actually do let's do the science segment, okay? Also, right now, this is a call for everyone that's gotten a vaccine today or this week. If you've gotten a vaccine today or this week, tell me, okay? Okay, Sam, dude, send me the thing, send me the stuff. Okay. Oh, you got it, Butterfly. Oh, you got your shingles? Okay, dude, Butterfly, you got the shingles. Let's see, guys. Oh, Butterfly, let's see it. Butterfly, huge win, guys. Good job, Butterfly. Good job. Way to go. Thank you for getting your vaccine for shingles, Butterfly. That's awesome. Every single vaccine, guys, every single shot, we celebrate you. Thank you, thank you, thank you. Thank you for taking public health seriously. Thanks for taking your health seriously. We love and appreciate people that get vaccinated in this community. Thank you, thank you, thank you. All right. And now. And now, the peer review. All the cool things that are happening in science. that nobody talks about except for here. Except for right now. All right, ladies and gentlemen, we have a cool one today. AI. AI-powered brain device allows paralyzed man to control robotic arm. The human user and AI have shared autonomy and constantly interact to complete tasks. All right, here we go. Check this out. Check this out, guys. Watch this. Watch this. Ready? Ready? Boom. Oh, does that look cool or what? What is up, dude? A man with partial paralysis was able to operate a robotic arm when he used a non-invasive brain device partially controlled by artificial intelligence. A study reports the AI-enabled device allowed the man to perform screen-based tasks 4 times better than when he used the device on his own. That's cool. Brain-computer interfaces, BCI, capture electrical signals from the brain, then analyze them to determine what the person wants to do and translate the signals into commands. Some BCIs are surgically implanted and record signals directly from the brain, which typically makes them more accurate than non-invasive devices that are attached to the scalp. Jonathan Coe, who studies AI and BCIs at the University of California, Los Angeles, UC, whoop 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 whoop, and his colleagues want to improve the performance of non-invasive BCIs. The results of his work are published in the Nature Machine Intelligence this week. First, the team tested its BCI. Again, BCI is the brain-computer interface. So first, the team tested its brain control interface by tasking 4 people, 1 with paralysis and 3 without, with moving a computer cursor to a particular spot on a screen. All 4 were able to complete the task with the majority of the time. Wow, that's incredible how fast that's so cool. When the author added an AI co-pilot to the device, the participants completed the task more quickly and had a higher success rate. The device with the co-pilot doesn't need to decode as much brain activity because the AI can infer what the user wants to do, says Coe. That's really cool. These co-pilots are essentially collaborating with the BCI user and trying to interfere the goals and the BCI users to what they wish to achieve, and then helps to complete that action, he adds. The researcher also trained the AI co-pilot to control a robotic arm. The participants were required to use the robotic arm to pick up colored blocks and move them to marked spots on a table. The person with paralysis could not complete the task using the conventional non-invasive BCI, but was successful 93% of the time using BCI with the AI co-pilot. Wow. Those without paralysis also completed the task more quickly when using the AI co-pilot. Wow. That's incredible. From not completing it to 93% success rate. That is incredible, guys. Wow. That is really cool. That is really cool, guys. What do you guys think? Pretty cool? What do you guys think? Pretty sweet? Nothing? No, I'm just kidding. I know you guys like it. Yeah, I'm just kidding. Let's go. Let's go. Let's go, guys. Let's go. Very cool, huh? Very cool. And now your turn, guys. This is your turn. This is your thing. Thank you guys so much for supporting the stream. This is your time. This is where we highlight you. Thank you, Butterfly, for being the last subscriber. Appreciate you so much. Thank you for the top gifter, Butterfly, again. Thank you so much. D. Pelletier, Jay Shellman, Ducray, NB Kami, Jen, Stars, Rebecca Collins. Thank you guys so much. Thank you for 1 like, 2 likes. Oh, what's up, Olivia? How's it going? Did you just see the science segment? That hat gets so it messes up my hair. It messes up my hair. But Anne, Alina, Peace Love, NB Kami, Melanie, Jen, Lefty Left, Ducray, Darcher, thank you guys so much. Thank you guys so much for supporting the stream. Whether 1 like, 10,000 likes, or 13,000 likes like Anne. Thank you guys so much. That's so cool. Also, guys, if you could follow and remember to share the stream, that is a big way that we can help. And also, my link tree right here, there's a link to our Discord. And we're starting tonight, guys. Starting tonight, we're going to do subscribers only voice chat at the end. Oh, sweet. We got a super chat. Oh, cool. Brandy, thank you for the super chat. Thank you, Brandy. Thank you so much. I appreciate you. So we're going to start doing after stream subscriber only hangouts in the Discord, guys. So I'm going to chill there for like an hour. We're going to hang out and have kind of like a group chat where everyone can kind of chill and talk. And yeah, so there you go. Also, Linktree also has right here, that has my show notes. The Discord has the show notes, so all the primary sources are there. Also, all my publications are right here. So you're curious, like, what kind of scientist is this guy? What does he do? Which is like a perfectly valid thing to ask a scientist. Where are your publications? And there they are. They're right there. And also in the link tree has my YouTube archive. So all my lives are archived, and that is if you wanted to watch a show, go ahead and do it. And that's it. That's it, guys. We did it. Loved it. That was cool. All right, guys. We are. All right. All right, Leonard. Leonard's up again. Leonard, what's up, brother?
So I have a question about like
Melanie.
spreading COVID.
Thank you, dude. Thank you. Thank you. Appreciate you, Melanie. Go ahead, bro. Sorry.
You're good. I have a question about contracting COVID and spreading COVID, right?
Okay.
So if I were to get the vaccine, right? Could I still spread COVID?
Yeah, so we got to separate SARS-CoV-2 and COVID-19. All right, so SARS-CoV-2 is the virus, and that is the virus that spreads. COVID-19 is the disease that you get after you get SARS-CoV-2. So this is just like HIV and AIDS. So you contract HIV, but then that goes into AIDS if it's untreated, right? So if you are out in the world with the vaccine, even with a vaccine, a viral particle landing on your nose, the vaccine isn't going to be able to stop that from happening, right? You're not going to live in a bubble after you get gotten a vaccine. So what's going to happen once that viral particle lands on you, if it gets into your system, there's basically there's the learned and then the innate immune system. The innate immune system is first. So the innate immune system is kind of like all the barriers that have to happen in order for you to get there. It's kind of like an obstacle course. So a virus has to go through all these obstacle courses in order to actually get into your cells and start to replicate. So once it gets there, then your trained immune system takes part. So now it starts attacking, and it starts going and creating the antibodies against that viral particle. So if it's a small enough viral particle amount and the viral load is small enough and the antibodies are already in production enough, then that might be it. Then the viral particle might just be squelched, and that's it. But imagine that you start producing viral particles enough, and if you don't have enough antibodies, or if you takes a couple days for you to make these antibodies, then the viral load was going to go up. Okay, if the viral load gets to a certain amount, that's when you get COVID, right? You get COVID and you start getting those symptoms. But if you have a lesser amount of viral load, the lesser the viral load that you have in your body, the lesser amount of viral particles you can spread to someone. So yes, having a vaccine does help you stop the spread of the actual virus, because you have less viral particles in your body, so you're going to spew it less. Okay? But you can still, if you have not enough antibodies, then yes, of course you can actually develop COVID, and you could actually technically still die. So the most amount of people that have died from COVID are vaccinated, but that's just because most people are vaccinated. So that it's just kind of like a numbers game, but that
It's a
doesn't.
numbers game. Yeah. Okay. So, all right. So it doesn't totally stop you from getting COVID or contracting COVID. But it does help you from not spreading it as much.
Exactly. And if you do develop COVID, you have less viral particles. So that means that you're actually less likely to die once you do get COVID. You're 10 times more likely at the height of the pandemic to die from COVID-19 if you were unvaccinated. If you had the vaccine, you were 1/10 as likely to die than, if you had the vaccine, which is crazy, dude. I mean, do you play video games, bro?
Yeah, I play COD and I play a lot of Madden. I love Madden.
Okay. Like, I mean, I played a lot of role playing games and stuff like that, where like I would do insane amounts of grinding, bro. Like hours of grinding every day, every day, or hours every week, dozens of hours just to get an item that improved my DPS by like 1%, 2%. We're talking like 10 times, man. Imagine your DPS going from 10 DPS to 100 DPS. Like in a video game, bro, you do that every time, bro. Every single time. I mean, we're talking like astronomical amounts of numbers here.
So say if you look at the people who've died, I didn't ask you this question yet. If you look at people who died from COVID-19, how many of those people had already had underlying health conditions?
So a lot of them are older, right? So they are older, but that doesn't mean that we should sacrifice those people. But also those people, the underlying old people that have the health problems, guess what, man? Those are the people that are actually the ones that died from the vaccines too. The 100 people that have died from the vaccines, those are the ones. So it's like, it's odd to care about and say, like, the numbers game is crazy to me. Like the fact that we are like people want to sacrifice 60-plus-year-old people to COVID and just say that. I mean, I remember the Republican Party was saying during the time during like early 2020, like grandma's gonna need to die for the stock market. Like that, they were saying that, like, that we're not going to shut the country down.
I know. Yeah, they did say that.
Yeah.
I've been trading the stock market for like over like 12 years now.
Okay.
10 to 12 years. So
nice. How's the last month been for you? It sucked for me, dude. It sucks.
No, good. No, so I'm a trader. So I've been trading since I was like 14 years old.
Okay, so what do you trade?
I trade futures and commodities.
Futures. So oh my gosh! Yeah. Wow. Okay.
Yeah, I've been doing that for a long ass time. It took me a while to get good though.
Why futures?
It's the market moves a little quicker. It's a lot harder, but there's you can make a lot more money from trading futures. If you're trading like commodities, like natural gas, price action moves a lot slower.
Okay.
So the only way you could trade that and be successful is if you trade really heavy size, or if you swing trade it. Meaning, when you swing trade, you're holding positions overnight or for.
So you're doing zero DTE?
I'm sorry.
You're doing zero DTE, but it's futures. So, but are there? I thought there aren't options for once the market closes.
Okay. Yeah. I don't trade options. I trade commodities, and I do trade indices too. So I trade like the NASDAQ and the S&P.
Okay.
Yeah. So for a long time. Yeah. I lost a lot of money at first, man. But you end up getting good, and then you end up kind of. It's just like with anything. When you study for your PhD, it probably took you a long time to get that PhD, right?
Yeah.
It's like with anything in life, and like for you to be an expert in something, you had to do it long enough.
Yeah, so this, I'm glad you brought this up, bro, and I ask these questions because it's always interesting to people I try to make analogies to things that people are experts in, and I trade myself. I started getting into trading during the pandemic when everything like shut down. So, like basically, getting the vaccine, dude, is like buying and holding like SPY versus like the unvaccinated people are like basically zero DTE on a penny stock. You know,
Yeah.
you know, there's no way, bro. Like you're gonna
Yeah.
crash out eventually, and it's like that
Yeah.
doesn't make any sense.
Like small cap stocks.
Yeah,
I know. Yeah.
exactly. So like,
Yeah, it's crazy.
so it's, you know, like the obvious choice, man, for unless you are really into it and you're really trying to micromanage this thing and you're really living in a bubble and you're like, I'm gonna avoid all this. You gotta really like lock in. But even still, it's like it doesn't make any sense. It's better to do like, if you're going to do like options or something, play options on SPY or Q or something, you know, as opposed to
on QQQ. Yeah, but
Yeah.
it's tough. Like it's like 90% of traders quit within their first year,
yeah.
which is crazy. So,
Yeah.
but yeah, back to our conversation. I'm sorry.
But you see what I mean though, man? How risky
Yeah.
it is to like to be unvaccinated and stuff, where you can like, you might be able to say you hit that, you know, that run and you think that you're a genius and it's like, oh man, this is so easy, but like you can't do zero DTE on some micro caps for 20 years and make a profit. You know what I mean? Like it's just not possible. Do you know what I mean?
True. Yeah.
So that's what the analogy is, bro. Like does that make sense?
Yeah. Yeah, for sure. I totally understand what you're saying.
Yeah.
I just, with the question I was leading to is, so like say if someone's vaccinated, I am not vaccinated. So I can spread COVID a lot easier, right?
You can spread SARS-CoV-2 easier.
Okay.
That is something
Oh, yeah,
that is
SARS-CoV-2.
something that you could leave this conversation with, that would actually improve your better understanding of things, like would be just separating out in your brain SARS-CoV-2 and COVID-19. The problem is that in our culture and in our science communication and everything, we just use COVID-19 for everything, but in reality they are two totally different things, and it's actually very specific for a reason. So,
But didn't you say if you get SARS-CoV-2, you pretty much automatically get COVID-19?
No. Then that's actually one of the interesting parts about SARS-CoV-2 is that it's called asymptomatic spread, and you can actually spread it really easily without having COVID-19 symptoms. So a lot of people that are spreading SARS-CoV-2 don't know that they have it.
Interesting.
Mm-hmm.
Damn, you never
Asymptomatic
told me
spread
that,
means
dude.
that you don't have symptoms of COVID-19 when you are SARS-CoV-2 positive. See
Okay.
why it's really important to have these, like now we have this differentiation. So now we can actually now we can better understand what's going on.
So if I were to like spread it to somebody, say if I were to spread it to, say if I had SARS-CoV-2, right? And it was easier to spread, right? And I gave it to someone that was vaccinated. Are they protected with the vaccine still?
It matters how much viral load that you put on them. So maybe it's like at what stage your infection is with the SARS-CoV-2. So if it's at an early stage and it's a really small amount of viral particles, then yeah, they're going to be relatively safe and they might not be SARS-CoV-2 positive. But if you're in the exponential growth phase where it's like right at the peak, 2 days after your infection, then yeah, there's a good chance that they get it.
Oh, okay. So if they get it, right? You said depending on the viral load, okay?
Yeah.
But say if they end up contracting SARS-CoV-2 and say, like you said, it's most of the time, does it lead to COVID-19 or not most of the time?
No,
Or a
SARS, it's
minority?
asymptomatically, it's spread and it doesn't normally go like that. Yeah.
Okay, so if I give like a vaccinated person SARS-CoV-2, are they going to be more protected than an unvaccinated person?
Yes.
Okay. And damn, I'm trying to phrase these questions because I'm trying to get there, but I'm just trying to phrase these in the correct way where I can understand a little better. So they get it, right? They contract it. They're safer than I am, right? But like a healthy individual like myself, and they're safe because they have the vaccine. What's the point in somebody very, very healthy to get that vaccine if they already know that they're young and they're healthy and they work out and they say they fast, they eat healthy? Because a lot of people I've seen, the people that have unalived are people that have those underlying health conditions. But
Yeah.
if they're vaccinated, they're protected, right?
No, because you're still spreading it. You're spreading viral load like onto them, which is, and you're spreading more of it because you're unvaccinated. And then two, like basically the more viral genome copies that are out there of SARS-CoV-2, the more viral recombinations that can happen. So and that's
more
where
they evolve.
mutations come from. So basically, you can get infected with multiple types of genome types or strains of SARS-CoV-2, and they go through this thing called viral recombination. So their entire genome shuffle, and that's where a lot of these multiple viral genome mutations happen at the same time. So and once those mutations happen, then it makes the vaccine less and less effective over time.
Interesting. So then that's when they have to get those boosters and the new vaccines every year.
Exactly. Yeah.
Okay. So that's how it's okay. So that's how it basically saved all those lives because of
Exactly.
of that.
Gotcha. Exactly.
Okay. Interesting. All right. I was just wondering
Nice,
because that question was very important. Did I phrase it correctly in a way that?
Yeah.
Okay. Cool. All right.
Yeah.
Because I'm not an expert in this field, like
All good, bro.
medical.
All good, bro.
Reading tape and order flow, that's me. That's what I do. So
yeah, bro, this is like vaccines is like the second order options order flow where you're looking at that buy wall and it's just like it's looking good.
Bit
dude.
in the ass.
It's looking good. There's not that stop at that next Fibonacci sequence or that fib. So you know what I mean. It's just green. It's a melt up, bro. It's a melt up. There's no price discovery mode going up.
Yeah, it's kind of like the same thing that you do, right? Like in a way, because you guys look at a lot of data, right? Mm-hmm. Same with me, right? So I basically I've taken all my trades it took me like a good 5-6 years to get good at the skill, and then I ended up working at a bank for like 2-3 years. But after that, now I'm just like a retail trader trading from my home. So pretty much is you take all the historical data that you have and you build it into a quant. And the quant takes all your historical data and it tells you what percentage likely on this specific model of a trade that you will win on. But
are you doing quantitative trading? Are you doing with
yeah,
Quant Connect?
I've been doing that. What?
With Quant Connect?
No, so I built my own quant. I spent a lot of money and I paid someone to build my
damn.
quant.
Oh, cool.
Yeah,
dude.
it took because I don't know how to code. So I had to pay someone to take all my
I was looking into
data
Quant Connect, dude. It looked sick. It looks really cool.
Yeah, I've never heard of that actually.
That's the open source like one that's Quant Connect. Yeah, that's it. QuantConnect.com, the open source algorithm for trading. I was like, because I was gonna hook it up to my IBKR account and just like put some money in there and see how it does. So.
Watch out for those though.
Okay.
Because those get you. Because if everyone's using the quant, right? If everyone's using it, you're definitely in a bad spot. Because if everyone's using it, the people that are really good and have their own quants, or who are dealing with all the money, they'll just stop your ass right out.
Gotcha.
Yeah, so watch out for that shit.
Bro, I'm telling you, man, I think that those are good questions. I'm happy that you're here, dude. Like, you can come in, however many times you want. So it's all good. And thank you for coming in again and asking, like, more questions, man. I appreciate you.
Good to talk to you, man.
Good. Yeah, likewise, man.
Sure.
Have a good one.
Yeah, you too.
Peace. All right, Amy actually requested, guys, and then she didn't. So I don't understand. There was a mistake there. She requested, and then let's see. Let me see if I can find her. I can't find her. Maybe she doesn't have the followers or something. Oh, thank you, Open Sets. Thank you. Oh, okay, yeah. I sure don't. Yeah, you requested Amy, and then you denied it. I don't understand why you. Yeah, dude, Nick, the nose spray is pretty sick. I think it's a cool idea. So it basically it's like little little pieces of, like, it's a new nanotechnology delivery platform that is a really cool way of doing it. Okay, bro, what's first, and then Linda, and then that's it, guys. These two, and then we're done.
Hi,
bro. What? How's it
can you
going?
hear me?
Yeah.
I thank you for accepting me. I just want to ask you a question. What's your favorite scientific fact?
That you are. Hi, Marissa. I love you too. Thank you. That if you counted all the cells in your body, like microbe, human, microbe, human, micro skin, microbe eye, microbe heart, all of that, and you just counted it all up, you are 50% microbe and 50% human. So who you are right now, what you think your body is only 50% human cells.
Oh, that's cool.
Yeah, isn't
So
that
that
awesome?
means, yeah. Well, thank you. I just want to ask you that.
Oh, perfect. I love it. Favorite call of the night. Awesome. All right, is that it?
Yes.
Okay, cool. Well, have a great night, okay?
You too.
Bye. Awesome. That was cool. I like that. That was fun. Okay, Linda, your last one. Closing out the night. Hi, Linda. How's it going?
It's going fabulous. How are you this early morning?
Good.
I am one of those folks that has 4 autoimmune diseases, plus I have level 3 liver damage because
Oh,
my
no.
wonderful first husband left me with Hep C that was untreated for 4 years.
Oh,
So I have to do IVIG, human immunoglobulin, at maximum dose allowed by the DEA every
wow.
8 weeks for 5 days. So I have a port, so IVIG goes straight to my heart. I can't have any live virus vaccinations
Oh,
within
wow.
60 days of having treatment, but I have treatment every 60 days.
Yeah.
So I totally appreciated Leonard's being very candid and very open to this discussion for the last couple hours.
Yeah.
Because when you ask why a completely healthy person would go ahead and get vaccinated,
Mm-hmm.
you do it for people like me that can't get vaccinated.
Yeah.
Human
Yeah.
rhino, in February of 2020, I ended up in ER, ended up isolated in the hospital for 3 days. The only thing, and they tested me, it was before there was a COVID-19 test, but they tested me for 5 different other kinds of COVID. You name it, they ran it. Because when I hit ER, my magnesium, my potassium, and oh, hell. There's another one that were totally bottomed out. They thought I was going to have a heart attack before I ever got to bed.
Dang.
And the only thing I tested positive for was the human rhinovirus.
Oh, wow.
That's the common cold. So if
Yeah.
a common cold knocks me down that far, I had to be completely isolated throughout the pandemic because the internist flat said, if you catch it, you're gonna die.
Dang.
If a cold wipes you out like this, you're done.
Yeah.
So
Dang.
that's why healthy people get vaccinated, because there's people like me in this world that can't afford to get a cold,
Yeah.
let alone something as drastic as COVID-19. So, if my story, and it's my journey, God put me on this journey for a reason, right? I figure that when I come back around in my next life, I'm going to be one badass woman.
You already are.
But it's all about the way you approach it and being positive, right? Because if it isn't me, it's going to be somebody else that's going through it. And somebody knows that I could handle it. Otherwise, I wouldn't be dealing with it.
Yeah.
But if stories like with people that are immunocompromised like myself can help others that don't appreciate the vaccines and what they can do in eradicating simple communicable diseases like measles, and now we see an outbreak of measles
Exactly.
with the increase of anti-vaxxers. If folks can look at it as not only protecting themselves, but they're protecting other people.
Yeah. It's so
Folks like
true.
me that just can't. We
And
just can't.
There's like we had someone that had that their kiddo had a genetic disorder that was triggered by SARS-CoV-2 and COVID. So if they developed COVID-19, then they would likely die too. So it was like they were coming on here talking about how it's awful that you have all these young people that say they don't need to get vaccinated and COVID isn't impacting anyone. And this is a mom going like, my son exists. He's important. Like he's
Right.
real. Like what are you talking about? And I can't imagine.
And I had to stay isolated. And we have a young son. We adopted our grandson, so he's in elementary school. He is on the spectrum and has ADHD, so it was very important for him to get back in the classroom for one-on-one instruction. Well, okay, there's a hell of a dilemma. Every day, I mean, he needed that one-on-one instruction. We lived in fear of me catching COVID. So, this little guy, we had to make some serious decisions.
Yeah.
And we sent him to school, but he had to, as soon as he walked in the door, he had to strip off everything, put it in the washer, and he had to go get a bath with, a cap full of the old brown bottle Lysol in it or whatnot,
man.
just to make sure that there wasn't anything that I was going to catch.
Yeah. Dang.
So we had a little guy that was 10 years old, and he was afraid that he was going to bring something home to mom that could kill her.
Ugh, that's awful.
There's no reason for a kiddo to have to think that way.
Exactly.
So, my take is a little bit different than some other folks, but it's just the world that I live in. And maybe if my story and my life experience can help others understand why we take vaccines and why we do the vaccine protocols, then it's all worth it.
Yeah, absolutely. Yeah, I thank you so much for sharing. It's
You got if people don't get educated and people don't know, how do you expect them to learn? The only way they're going to learn about something is for that correct information, to be put out in the universe.
Yeah.
So
exactly.
if by sharing that puts some correct information out there for these are the kind of experiences that some other folks are going through. And, I understand it doesn't affect you. We're in a society now that if it doesn't affect me, well, then it's not a big thing. Except for it does affect a lot of us.
Yeah.
So
Well,
it's kind of like, please put on your thinking cap, folks.
absolutely.
I appreciate every single person that has been vaccinated because it helps keep me safe. It keeps me on the face of this earth another day.
Absolutely. And Linda, we see you and we appreciate you, and I'm sorry that the pandemic and everything and public health hasn't been fought over. I feel like we've kind of ceded the
Well,
ground to these people,
yeah,
and
and we have to advocate. Patients have to advocate for themselves. The
exactly.
scientist, the academic and scientific community has to advocate for the research and the grant monies and whatnot to be able to find things to help folks.
Exactly.
You know, it's just it is what it is, and science is something that it's a definite. Now, when you go through all the protocols correctly and you do the research and you hit all of those things that academia requires and that the public in general is going to require of you, that's how we learn.
Yeah. Exactly.
And that's how we overcome some of these diseases that otherwise we wouldn't be dealing with. Because I was perfectly healthy until 2010. Absolutely perfectly healthy. I got a tumor on my bladder out of nowhere that they had to send it to 3 different pathology labs to figure it out, and it was finally the Mayo Clinic that came back and said it was benign. But it set my immune system in overdrive.
Dang.
That could not go back to a homeostatic state, and so it started attacking my body.
Wow.
So, it's one of those things, and it's one of those flukes. Life happens.
Yeah. You're so strong. You're so
You
strong, Linda.
you gotta go. Well, life's what you make it, and I absolutely refuse to just to exist in this world. I want to live.
Good for you. Good for you,
So,
Linda.
every good day is a celebration. Every day that your body says screw you and you're going to be in the bed, you say, okay, well, tomorrow's another day. And you just go. So it's just something for folks to think about when they question, why do I need a vaccine? Because I'm a healthy person. It's for people like me and
Well-
thousands, hundreds of thousands of others that are like me.
Exactly. I totally agree. And it's yeah, well, we are huge mental health fans here, so whenever you get your IgG transfusions, you can come back and we'll throw you a vaccine party, okay? I promise.
Ah,
Okay?
no worries. I've been doing it for 6 years. They say I'll be doing it for the rest of my life.
Nice.
And when you look at, and folks that say they look at the costs of vaccine versus being treated, my rounds of IVIG, just the medication, is $250,000 every other month.
Oh my
And
gosh.
I've been doing this for 6 years.
Wow.
Thank God my insurance covers it all.
It's
I was forced
$100,000
to
a month.
retire.
Oh my God.
I was forced to retire because of my medical stuff. But you figure I go through 1.5 million just in that medication per year.
That's crazy.
So,
Man.
if vaccines can stop stuff like that from happening, yes. Yes, yes, yes. 100 million times, yes.
That's so
Because
cool.
the cost of, when you look at the cost of just my medical care, it would blow your damn mind.
Man,
You
you're
know,
incredible.
and thank God that I'm still, I walk around and I hang out with my kid and I do what I got to do. And I just refuse to let the disease own me, especially mentally. I refuse to let it own me.
Yeah.
The cost of what it takes to develop and promote a vaccine that can save hundreds of thousands and millions of lives is nothing in comparison to lifelong medical care that is astronomical.
Exactly. That's
Well,
so
I
true.
appreciate your time and
Thank
thank you
you.
so much for having me on.
Yeah, absolutely.
I wish everybody a fantastic tomorrow, being how we're in the middle of the night. And enjoy yourselves and enjoy life.
Thank you, Linda. Thank you so much. Your story, we hear you, we appreciate you, and I will remember it, and I'll tell people your story. And thank you for letting me advocate for you, and I'll keep fighting, okay, for you and for public health in general. I promise, okay?
Thank you. Appreciate your
All right.
time.
Have a good
great
one,
one.
Linda.
Bye-bye.
Man, that's really deep. Thank you, Linda. Thank you so much, guys. Exactly, guys. Linda is why we fight. It's exactly people just like that, you know? It's really important. Guys, I was supposed to end at midnight, and honestly, I think that we should respect Linda and like what that was so that was incredible. I think we should all just kind of like I think we should end the stream there just to think about that. That was really powerful, and what an amazing story that she could share with us. And yeah, it is a good note to end on. Exactly. Yeah, Skog, Marsha, I'm sorry, but we're just I gotta go to bed. I gotta be up. I got a field trip to chaperone tomorrow. Exactly. To Linda. This stream is dedicated to Linda, guys. That was that's exactly why we do it. That's exactly why, guys. Thank you, Christy, for jumping in. That was really nice. Thank you, guys. One quick trip through. One quick trip. Let's see what you guys did. Thank you guys so much. Melanie McGee is the last subscriber. Thank you so much, Melanie. What is that? Is that one of those fire sticks? That was incredible. All the top gifters. Thank you guys. Butterfly, Duke Gray, Jay Shella, and the top likers. Thank you guys so much. Anne, Alina. I think I'm pronouncing that right. I don't know why I was tripped up before. Not tripped up, but no, I'm tripped up now. It's late. I'm late. Peace, love, and dwubs. Thank you guys so much. Thank you guys so much. Man. To Linda, for sure. Thank you, Linda, for sharing your story. Thank you, guys. All right, we're going to hang out. Subscribers only. Subscribers only chat in the Discord. We will be there hanging out for the next 30 minutes. It'll be on tomorrow at 9 o'clock. I think so. I'll only be here tomorrow, 9 o'clock, 9 p.m. tomorrow. I guess I'll be here if Ducray's here. I don't know. I wasn't going to do anything. Like Ducray or Jen was there. You know, we'll see. You know, I don't know. I got a lot to do. Maybe, I don't know. I got a lot of stuff to do. You know, I don't know, guys. Okay. All right. If Ducray's there, I'm going. All right. Fine. Crystal's going to be there too? Oh my gosh. I'm down. Okay. Oh, NB Kami's going to be there? Okay. I'll be there. Fine. You guys drag me in every time. Ado's in? Okay. You guys drag me in every time. All right. Let's do it, guys. See ya. Oh, call me Bob. Thank you just for the subscription. Thank you. Call me Bob. See you at the Discord, bro. We're going to chat. We'll hang out. Dude, see ya. Discord, hangout, subscriber. Let's do it. Boom. See ya. Pop. See ya. To Linda, guys. Legend. Absolute warrior. Thank you, Linda. See ya.